but if you have your phone, please silence it and make sure to engage in conversations outside the chambers. If you are here to speak under public comments on a particular item on the agenda, please fill out a request to speak card and turn it into the city clerk. The cards are located near the doors at the back of the chambers. And obviously, all are welcome to speak. Uh, Madam Clerk, please take the roll.
Councilmember Spriggs,
Here.
Councilmember Patton,
Here.
Councilmember West,
Here.
Mayor Pro Tem Bragg,
Here.
Mayor Dedina.
Here. Great. And now did you want to introduce the Girl Scouts? And now it's my pleasure to invite Imperial Beach Girl Scout Troop 6179 to lead us in the Pledge of Allegiance. And it's amazing to see all of you here. Thank you so much. Thank you so much to you guys and your families. We really enjoy having you guys here. You're welcome back anytime. We obviously are big fans of the Girl Scouts in Imperial Beach and appreciate all the outstanding civic work you do. And we're always here to support you for any projects now and far into the future. And of course, your families as well. Thank you so much. Great. Any agenda changes? Anyone?
No, Mr. Mayor, I just had an agenda comment on the consent agenda. The Treasurer's Report, item 2.3. I don't want to pull it at this time because we have such a full agenda this evening plus closed session. But I would like to ask that we have a full discussion of the Treasurer's Report, perhaps when the our investment company is available, because our rate of return on our $28 million in managed funds is about half of 1%. And this is costing our citizens several $100,000 a year. Right. So I'd like to have that item come back when we do have them available for discussion. Thank you.
Thank you. Duly noted. Great. And now we can have updates and reports from council members, starting with Mr. Spriggs.
Thank you, Mr. Mayor. Not a lot to report. The League of California Cities had their annual conference on September 13th through 15th, which I attended and voted on the various resolutions on behalf of the city. Nothing really of direct impact on the city of Imperial Beach. There were a number of workshops that I attended that I'll report on maybe at a future meeting when I get all of the slides and materials from the web conference website, which haven't been posted yet. I would note that I met the president of the league, the incoming president, and they have confirmed my appointment as chair of the league's policy committee on housing, community, and economic development, which is quite a good post in the league because it deals with so many issues of relevance to our community and many communities, like economic development and housing and those sorts of things. So I look forward to that service in the coming year. Also, I don't know whether it will be on the next agenda or not, but because of that appointment, I've been invited to the league's leadership committee or leadership meetings, which will be taking place in November. And that's where their agenda and priorities will be set for this coming year. So I will be once again pressing for more attention on coastal city issues and for even a greater commitment by the league to the issues that we have to deal with here in Imperial Beach and other coastal cities. Thanks.
Great. Thanks for your leadership on that. We appreciate it.
Yeah, congratulations. We're all lucky to have you. Yeah, very nice. Yeah, give him a hand. Okay. So a few things. The Dempsey Surf Contest. I know Mr. West was the announcer. I handed out some awards. I was just really pleased. It's such a local event, and I know the mayor and his crew make this thing happen. But the kids, the locals, it was a great event, and it was the 14th annual, and I look forward to the 15th annual. The triathlon happened, and I think there was 0 rescues. Is that true? 1 rescue, but no matter what, that just means the lifeguards did a superb job, and so congratulations to them and the city on that. One of my favorite events coming up, the Auto Fest, this Saturday, October 7th, from 9 to 3. It's gonna be great. It's on the pier. It's down Old Palm Avenue, Seacoast, and it's a great event. And I think you'll enjoy it if you go check it out. Brings back memories, because you'll see a car that maybe your parents used to have or that you used to have, and you get a picture by it and wish you still had it. Lastly, 9th and Palm, I'm excited every time I go in there. I went to Five Guys, and there was only 3 guys in there, and
Wait, it already opened?
there's only 3.
Oh,
So I'm just waiting for the other 2 to come.
okay,
so
I get it.
we
Okay, I'm
can-
not
so
very
it can be
smart.
open.
Sorry.
That's it. Thank you.
Okay. Sorry, Bob. Really slow. Mr. West.
Yeah. Some things that we did over since the last meeting we met with the Sandag Bayshore to Bikeway meeting that was held on September 22nd. Unfortunately, there's going to be a delay on the finishing of the National City portion, because when they were doing it by the naval base there, they found a power cord or a power line that they didn't know existed. So they actually had to stop work, and it's delayed it. They're working on it. They had to move it, but it's gonna delay it a little bit, but it's really moving along well. One of the things we also talked about at that was that they're going to be doing the community group, the border to bikeway portion, that they're going to actually hold in November, actually at our bicycle village. So it'll be a really great time for you to come out and voice your options and think what you want to have, and look what they're actually developing for our border to Bayshore Bikeway. September 23rd, I was over at the Civility Day in Chula Vista with Mayor Salas and Councilmember Aguilar from Chula Vista. It was and District Attorney Steffens. It was a very interesting event. We talked about how, communication needs to be civil and getting away from our phones and actually talking to one another. So it was a great event that was really interesting for that day. Also, I was very happy to be a part of the Suncoast Co-op, our opening of our co-op here in Imperial Beach. The Suncoast Group had our first owners and steering committee meeting on October 2nd. Great turnout. I'm very excited about the group promoting healthy eating and healthy lifestyles in our community. And if you're interested, please go to their website and take a look. It's a great group of people. October 7th, this weekend is going to be busy. We've got so many things going on, but I don't want to forget Two Wheels Cycling Shop is actually having their grand opening that day. And if you bring this in, you can bring this flyer in, which I will leave for anyone who wants to bring it in. They get 20% off their bike parts, and they're going to have tacos and a bike giveaway. So Two Wheels, it's a great shop. I'm really excited about having them in our, and then also thank you for mentioning, I agree that I'm super excited about the Breakaway grand opening on that day. We were able to work with a group called Environ, and they're going to be putting a solar power car charging station out at the Breakwater grand openings for people to see and use, and going to be really interesting. They're going to have it there for about a week, so you can take a look at it. It's a great piece of equipment, and pretty excited about it. And yeah, there's all kinds of things going on, but I'm going to leave it at that. Oh, Tijuana River Valley, October 14th. We're doing the last of the cleanups that day, and then we'll have it follow that up. They're doing it at Goat Canyon. Big cleanup starts at 9 o'clock, goes till noon, and then the volunteer party at Borderfield State Park. It's the Wild Coast Surf Rider. I love the Clean San Diego group. So it's gonna be great.
Thank you, man.
Thank you. I hope you all notice that we up here on the dais are wearing pink ribbons. October is a National Breast Cancer Awareness Month. I don't notice if many of you noticed that some of the mothers of the Girl Scouts were also dressed in pink. Many of you in the audience are dressed in pink. I would encourage all of you, men and women, to get your mammograms and do it every October. So thank you. There is a lot going on in our community. It seems like summer's over and you kind of expect things to die down, but that's not the case. Coming up on October 14th, the Imperial Beach Fire Department will be hosting their open house from 10 to 3. That's always a huge event, well loved by the community. Chief French, thank you for doing this. Again, there's kid safety booths, I did want to mention the sponsors on this, IB Beautiful and the Certified Farmers Market and Vaughn's as well. So that is next Saturday, the 14th from 10 to 3. I am the MTS representative to Sandag. I was at the Sandag meeting on Friday, September 15th. Kind of a mundane routine meeting without a lot of drama or action, which is always nice. October 2nd through the 6th is National Rideshare Week. So I'm your transportation girl. I couldn't let this go by unnoticed. If you go to the icommute@sandag.org site, there is a link. And if you take a picture of yourself using rideshare, any form of public transportation, you can be entered to win a $50 Uber certificate. So please make sure you do that. I did want to mention that I was out of town. I was on the big island of Hawaii, and my sister and I used public transportation entirely one day. We it was a long trip, but we enjoyed it. And amazingly enough, there were a lot of people from Imperial Beach in Hawaii that week and the week prior to. So we all know where to get our little bit of paradise. It was wonderful. I do want to announce at this Saturday coming up, one of our most beloved events. So that's the Symphony by the Sea, proudly sponsored by the Port of San Diego. This event is really chaired by our city clerk and her staff, Jackie. So a round of applause for them if you like the event. It's the Wind Symphony and Symphony Orchestra. That is Saturday, right after the car show. Takes place at 6 o'clock. Bring your blankets, bring your chairs. Did want to announce the sponsors. We couldn't do it without the sponsors. So obviously the Port of San Diego is our major sponsor. Also the county, EDCO, SDGNE, and Don Brennan from San Diego Event Pros. So if you have not been to this event, please plan on attending. The special performance is Phantom of the Empire, Return of the Opera. So it should be awesome. So we hope to see you all there. Thank you.
Great, thank you. Speaking of Bikeway Village, in addition to two-wheel, it's called two-wheel boutique, right? Cycling boutique. There's Trident Coffee, which if you haven't tried it, it's basically cold brew and it's basically like nitro jet fuel. They call it nitro coffee. It's like the jet fuel of coffee. So last week I loaded up on some nitro coffee and rode my bike to Coronado, came back, went for a run on the beach, and then went for a swim in the water. So I had plenty of caffeine. So really, really cool. I actually had my Wild Coast staff meeting there on Monday morning. It's a really nice space. So they've got a little bit of food there, but anyway, it's really cool to see that. And you know, it's all kind of soft opening, so really nice to have that. And speaking of that, a couple weeks ago, I was invited to the wedding of Hugo and Maria Elena Salado. And Hugo grew up in IB and works for the County Department of Public Health. And he had his wedding. They live on 8th Street, so they rode their bikes. They had a whole wedding party, rode their bikes to the Bikeway Village. And the Butler family actually hosted the wedding for the couple. I think it's something they're planning on doing in the future. So they sort of were the wedding planners, and it was like a celebrity wedding. It's arguably one of the most beautiful spots you could have a wedding in San Diego County. And Lime Bike donated a lot of the bikes to be used. They brought a bunch of bike spines, so most of the people rode their Lime bikes. So it was actually really, really nice. So it was a really cool wedding and just showed how awesome that venue is. So anyway, congratulations to this council for making that happen and our city staff. So it's going to be a really great project. You guys didn't have a chance to approve this, and I didn't it was my trip to DC, which is very last minute to go with the Chamber of Commerce. So obviously that approval will be, I'm assuming, on a future, is it on this one or? Okay. So that was a last minute meeting. I'm glad I went. There in DC, it's this annual Chamber of Commerce trip. I was able to meet with Senator Feinstein, who at an hour meeting probably went on a 25-minute tirade about how concerned she was about the Tijuana River. Met with Congressman Juan Vargas, met with Congressman Duncan Hunter, met with high-level officials from the EPA, met with high-level officials from the State Department, met with the legislative staff for the Eric Calvert, who I think is the appropriations chair, and they met with the Mexican ambassador. I'd say the number one topic of discussion for the entire delegation was the Tijuana River. I was actually really, and border pollution, I was actually really, all the work that we've done to reach out with our colleagues and partners on both sides of the border has paid off in the sense that Terry Sano, who's the vice chair of Sandag, and the mayor of Del Mar came back to me and said, hey, you went to the meeting, but I brought up the Tijuana River. People in the private sector, public sector were bringing up the issue of the Tijuana River. The chamber under Jerry Sanders had made sure that it was one of the topics of discussion. So that was good to see that the entire San Diego delegation bringing that forward. Today I was in Tijuana all day for the Green, it's called Green Tijuana Conference. Again, really reaching out to our colleagues in Mexico at basically all levels of government. So between those trips and the trip in Tijuana today, I can tell you that thank God we were doing our legal action against the federal government, because what it's come to me is that the bottom line, we've done everything the right way. Our community has done everything the right way. Our staff have done everything the right way. Unfortunately, the tensions between the United States and Mexico, and frankly, the inaction by the Congress in terms of getting any budget straight, and the animosity to Mexico on the part of some congressmen has meant that there's zero funding for any effort to improve border infrastructure. And I'm talking about zero. That was, I also met with the North American Development Bank Chief Environmental Officer yesterday. Mark, you walked by us with your dog. We had a meeting at the pier. He reemphasized there's no money to do anything. So without us filing this legal action, which we just heard, apparently the city of San Diego City Council has also decided to pursue legal action related to the Tijuana sewage and wastewater contamination issue. Again, not sure, they haven't really notified us officially, so it apparently came out in the paper. They decided late last night to learn more about that, but we're on the right path and pursuing any and all measures to make sure that our residents in our city are protected. And so obviously, I think during the discussion of the proclamation of the cleanup month, there's a few more things that we can do, but I'm really pleased with the leadership of this council. Thank you guys. I know Lori and Bobby, you couldn't make it to the press conference, but you were there in spirit. We obviously called out your name, and our residents know that we're united on this, and we're gonna make sure that all of us are working together to move this issue forward and make sure that we're gonna make sure we have clean beaches 365 days a year. And as I told the guy from the North American Development Bank, and everyone knows, if I can surf every morning, I'm not hassling them at 5 in the morning, literally. And Captain Sabato knows that. Like, if I'm out, and actually with Councilmember West, we're out early in the water. So that just means that if I get to surf, I'm happy. We're all happy. And then we get work done focused on improving the quality of life here. But if when the water's polluted, we're spending most of our time focused on that. And what's nice is that the city of Chula Vista, the Port of San Diego, and the city of San Diego now understand it's not just our responsibility to shoulder the burden. This is a collective regional effort. And so I look forward to continuing that.
Mayor, your hard work is really amazing about this, and thank you so much for doing this.
This is a team effort. This is a team effort. One of the things, though, that's important that, you know, there's been a lot of chatter on Facebook about how the mayor loves Mexico and the mayor never criticizes Mexico. The mayor never says anything to Mexico. I got bad news for you. When we had the press conference, both press conferences we've done on this issue, we do separate press conferences in Spanish for the Mexican media. And frankly, people in Tijuana they're unhappy with Serge Dedina. They know that we're pushing them. They know that my son got sick. That was apparently front page news this summer. My son got really sick after surfing in July. The doctor here treated him, so he knows how sick he was and how sick he could have become if he wasn't treated. So that message is getting out. The main point today at that environmental conference that featured speakers from every level of the government was the Tijuana River. There just hasn't resulted in any money. So I told the head of the North American Development Bank, I haven't felt like I felt like a little bit like we've done everything the right way and the system's let us down. It just means we got to find you got to continue pushing. So, because no one else is pushing more than us. So anyway, yesterday at the last minute notice, so at the Switchfoot concert, WUV from POD, and if you don't know POD, they're a Christian metal band that all grew up in IB and Chula Vista, internationally renowned band. They announced the idea of doing a summer concert. They texted us like when, 2 days ago or something?
I didn't understand one thing on the day.
And said they wanted to come to IB and announce that they'd like to do a summer concert series. So tomorrow, and they came to the beach yesterday, took some photos with the Senegal Union Tribune. Tomorrow, in theory, in the Senegal Union Tribune, you'll read that they have a desire to do a summer concert, a one-day like summer festival, family-friendly event. So details to be worked out. I didn't want you to think that somehow we were planning something you didn't know about. You've heard it before anyone else. It was just literally on, I think, on social media. So, well, obviously they have to work with the city staff and identify how that will play out. They've emphasized though that they want something their own family members can go out, hang out, and go to and attend and have a fun time, like the Switchfoot event. What's really nice though is that it's Sonny, Marcos, and WUV all grew up in IB, all have connections to IB, and really love IB. Their first video, Southtown, music video, was filmed on our pier. So they really love this city, and they love the pier, and they love the fact that they're going to come back now that they're seasoned musicians and world-renowned musicians that come back to our city. They're just leaving for their South American tour, so they're really excited to be here just for a moment. And anyway, hopefully that should be a nice event. I think that's it. Oh, then finally, Iron Man really sets a standard for events in IB. Really nice event. 700 athletes. Thank you, Captain Stabenow and all your staff, and the sheriffs for making sure they had a great time. Didn't hear any complaints, and they spend a lot of money here. So really pleased about that event.
Yeah, Mayor and Council, we all have calluses on our knees from Houston to Florida to Puerto Rico and earthquakes in Mexico. As a former resident and employee in the Las Vegas Valley, I hope we have room for one more prayer for some of the things that are happening out there too. So just wanted to mention that before Chief French wanted to come up and share a few things about it going on, but I just wanted to mention that as a former resident of Las Vegas.
Mr. French, Captain French, or Chief French, sorry.
Mayor, City Council, just have a few brief items here. I just wanted to let you know that October 8th through the 14th is Fire Prevention Week. And I just wanted to kind of get the message out there. Every year they have a different theme, and this year it's every second counts, plan 2 ways out. So if you haven't done that already, plan 2 ways out of your house, get a plan that your family can work out, and they know 2 different ways to get out. On the 14th, Councilmember Bragg already mentioned that we have our open house. So I don't need to go into too many more details on that. Did a great job of promoting that. Thank you. On October 19th, so 10/19 at 10/19, the Great Shakeout. So here in California with the earthquakes that, we could possibly have, we want everybody to, at 10/19, to drop, cover, and hold on. So get the word out on that. We'll be doing that as a city staff here in all departments. And one last item, a couple council meetings ago, I gave a demonstration on the AED and told you that we were going to be putting those in the facilities. So if you look over there on the other side of Jackie, with the help of Dean, he mounted the boxes. So we have new AEDs here in the council chambers, one back in the community room, a couple at the Little League, one at the Little League field, one at the girls softball, and then 2 in our staff vehicles. So we've added 6 to the additional ones we have here in the city.
So is that something like, obviously for those of us who love Tom Petty, obviously it was tragic that Tom Petty passed away. And would that have been something that would have saved him if you would have had that? Like people, that's what the point is, to have people have massive heart attacks. Is that right?
Yeah, and it just depends on, how massive of a heart attack
Right,
and,
okay.
what the rhythms are,
Right.
whether that would be useful.
Okay.
So the sooner an AED is used, the better chance the person has of survival.
Right. And that's something that you have to be certified to use, obviously, right?
An AED, anybody can use that.
Oh, okay.
It actually has a voice that comes out and explains exactly what needs to happen. It'll kind of walk you through. It's pretty amazing.
You open the door on it and it'll tell you exactly what to do. And also once you pull the AED out, there's a chart that I put back in there that walks you through all the steps also.
Okay, good. Thank you
All
so
right.
much.
Thank you.
Now we have any additional, I have 1 public speaker slip, any additional? And I have Mariah Solana, is it Solana or Solana? Soldania from the I Live Clean San Diego. Thanks for coming.
So thank you all. As you said, I'm Mariah Saldana. I'm our manager of regional affairs at I Live a Clean San Diego. I'm here today to really thank the city of Imperial Beach for supporting our vision of a zero waste, litter-free and San Diego region, especially here in Imperial Beach. I can take my entire 2 minutes speaking very quickly about all of the ways that we partner together here with the city of Imperial Beach. But the one I want to make sure I point out first is the Clean Cities initiative that Councilmember West really spearheaded. So for any of those who don't know about the Clean Cities initiative, together with the City Manager's Office, Mayor Dedina, SDG&E, and Public Works, we worked with 687 volunteers throughout the year to remove debris and litter from Veterans Park, Rose Steeple Community Park, and 13th Street, as well as YMCA Camp Surf. One of those cleanups was even on Martin Luther King Day, and that was the start of our series. Over those 4 cleanups, we removed 2,325 pounds of litter and debris and even hazardous waste from Imperial Beach. We're really proud of that, and we're so excited to continue next year and to really grow these programs. I worked with a couple of these cleanups, and it was just so amazing to see all the actual City of Imperial Beach residents joining us, especially at the 13th Street one. One person came up just from the side of the street and just joined our cleanup. They didn't even know it was happening. They just wanted to help us. Also with the City of Imperial Beach, I'll quickly mention, we worked together on Tijuana River Action Month. We had our cleanup last Saturday, and we had around 65 volunteers clean up thousands of pounds of trash, including 55 tires. We had Coastal Cleanup Day about 2 weekends before that on September 16th. Countywide at Coastal Cleanup Day, we had around 7,200 volunteers, and we're looking at about 200 of those here in Imperial Beach. To try and protect those watersheds before we even get out there, we do watershed education presentations in the elementary schools in Imperial Beach. And last year, we educated 150 elementary school students on stormwater pollution prevention and how they can continue to take care of our ocean. So thank you all. We could not do what we do without your support, and we're so appreciative.
Great, appreciate it. And one, maybe you could start working with Caltrans. I think a lot of us have noticed how filthy the highways are. I'm sure you've noticed. It drives me crazy. I've never actually seen anything like that in my entire life.
I completely agree. We partner with Caltrans for some cleanups where we can kind of contract Urban Corps or other paid people to go and clean up those sides. But since we're really volunteer focused, Caltrans has never let us take volunteers out to those side streets. I will be at Caltrans Employee Recognition lunch next week, so maybe we can talk.
Maybe, yes, maybe you can let them know you heard from one of your city partners that they were shocked at the amount of debris, which obviously violates their water quality, stormwater permits.
I completely agree.
Great, thank you so much.
Yeah, thank you.
Great, any additional speaker slips?
No, Mr. Mayor.
Great, and now we have a really, really important update from the County of San Diego. I want to thank the County Health Department of Health and Human Services for coming out. We have Dr. Sayon Dialio Pavan, who's the Deputy Public Health Officer of the San Diego County Health and Human Services Agency, is going to have a presentation on the hepatitis A issue. So I want to really appreciate the fact that you decided to come out and you, at the last minute, I know it was the last minute invite. So
of course,
appreciate all the work you're doing educating the public.
Thank you, Mayor, and thank you, council members, and thank you everyone for being here. I just wanted to, even before jumping into Hep A, I just wanted to thank you all, because what I'm hearing in this meeting, and I've been to several city council meetings now talking about Hep A or accompanying, my supervisor or something talking about it, but is a lot of public health. We at the county, we have our Live Well San Diego, and it sounds so cliche, but it's about building better health, living safely, and thriving. And what I'm hearing is, let's screen ourselves before we get a disease that we could prevent or act upon if we find it early enough. Let's lead by example. Let's bike and live well, because we can talk about Hep A today or something else or Zika or something that's in the media, but at the end of the day, the things that are killing San Diegans across the county is chronic disease, right? So a lot of these lifestyle modifications and it really helps us prevent or have a better quality of life. And we know things like physical activity is as good as antidepressants in a lot of ways. So I just wanted to thank you. And then I heard also about, practicing for earthquake prevention and that kind of preparedness aspect. And then Hugo, Hugo is one of our kind of finest staff, and we were there presenting a Live Well recognition, and I presented it at the 10th annual Bike the Bay event, and to the San Diego Biking Coalition. So they were great partners, and we look forward to working with you, and just appreciate you all just spreading the word and helping along with that. So I'm here now getting to this topic. You know, I'm your Deputy Public Health Officer. And so I'm here to talk about hepatitis A. If you ever want me to come back and talk about any other kind of health related thing, I'm happy to. This is really getting at kind of a social determinants of health issue, as I'll talk about it. And I'll just paint the story of kind of what's going on in the county with hepatitis A that you hear in local media, national media, international media at this point, and where we are with the outbreak. So feel free to interrupt me with any questions at any time. And I know Mayor and Council and Mayor Pro, you heard this at Sandag or little versions of this, so just let me know if I'm repeating myself too much. But the first slide just really speaks to the power of vaccination. You see on the left side of the slide in the late 80s, early 90s, that you see a lot of darker blue spots, and that's where we had hepatitis A cases. And you see San Diego County is one of the darkest blue ones. And then you see in 2007 that kind of the whole map essentially turned white. And the reason for that, the big change, was the introduction of the vaccine in 1995, which became a routine childhood immunization in 1999 in California and some other high prevalence states, but then around the country in 2006. So what is Hep A? It is a virus that can spread easily from person to person. It's not as contagious, just to put it in perspective. It's not as contagious as measles or other things, but it is contagious, and common sense measures can help us protect ourselves against it. It can cause liver disease. It's just like hepatitis B and C. They're all called hepatitis because it causes inflammation of the liver. But this one is kind of usually for most people a short-term one that just causes disease for a few weeks, sometimes up to 6 months. And rarely death, which is one of the interesting things in this outbreak, unfortunately, that we're seeing more hospitalizations and death than we would expect in kind of the general population. And a lot of that has to do with who's primarily affected. So what's making this outbreak very challenging to control is the fact that there's a long incubation period. And what that means is that I can get exposed to the hepatitis A virus today and infected, but not get symptoms from up to 2 to 7 weeks from now. So that makes it very hard, as you can imagine, when we're doing our investigations and talking to someone who had hepatitis A, who was diagnosed by their medical provider, and saying, okay, well, where were you from 2 to 7 weeks ago, right? And things like that. And so it's hard. I mean, I can't even recall what I ate yesterday for breakfast, right? So it can live outside the body for up to months, depending on environmental conditions. It can be contagious, and someone could be contagious up to 2 weeks before they get the symptoms and up to 1 week after, sometimes up to 2 weeks. And then chlorination and kind of treatment of water usually kills hepatitis A, so there's no concern about it in our public water, like the drinking water that you get out of your taps. And then we know that vaccination with the full 2-dose series is the best way to prevent the infection. And especially in populations that are disproportionately affected in this outbreak, which are homeless and drug-using individuals who have less access to sanitation than likely we do. So how does it spread? Really, it's what we call, it's a little disgusting, but it's a fecal-oral disease. And so you have to somehow ingest a little bit of contaminated hepatitis, something that's contaminated. You have to touch an object that's contaminated, eat a food that's contaminated, or drink water that's contaminated with hepatitis A. And you just need microscopic amounts that you ingest. And you can also get it through sexual contact and using recreational drugs as well. This outbreak is unique because this is really based more on that close person-to-person contact. It's not food or waterborne at this point. Yeah, so these are the symptoms. There's these non-specific general symptoms in the beginning where you suddenly get a fever, start feeling weak, and start feeling nauseous and loss of appetite. And then what usually brings people in to seek medical attention is that they start getting yellow, they start getting jaundice, start throwing up, they have what's called Coca-Cola urine, and pale stools and diarrhea. And this is the number of our cases in the county, all cases, whether it's outbreak related or not. And you see that just like that, similar to that first slide I showed you, with the introduction of the vaccine, you see the numbers had declined a lot after it became routine childhood immunization in California, and then even more as more and more people got vaccinated and it became routine for all children in the States. And so we were at about 15 to 40 cases a year in the last few years. And then you can see this year, we're up to 495 cases, and that's including outbreak and travel, kind of our background related cases. We are the second largest hepatitis A outbreak in the country since 1995. So the second largest outbreak, and so far it's plateauing, and we might eventually take over and become first. The interesting thing about this table shows you some of the larger hepatitis A outbreaks in the country over time, and the largest one is 2003, and it was foodborne from Chi-Chi's restaurant in 2 states. And you see that when you have foodborne related hepatitis A cases, it's usually more of a general population that's affected, and you see a much lower death rate or hospitalization rate. And then, but us and Michigan, we're having these large close person-to-person contact outbreaks, where it is due to, primarily, homeless individuals or drug-using individuals who are living and having that close person-to-person contact in unsanitary conditions. Okay. So we have 481 cases as of this week, and we update our numbers every week. It's on our website. We're redoing it to make it a little more user-friendly. We have a 70% hospitalization rate, and we have 4% deaths. We had 17 deaths. This is primarily affecting, 2/3 male, and the age range is from 5 to 87, but that 5-year-old is an outlier because they're from a family that didn't believe in vaccines and they didn't get vaccinated. So, but other than that, the next age is an adult. And so when you look at the type of people affected, this gets pretty interesting. 33% are homeless and illicit drug users, which is IV drug use and non-IV. It's more kind of the street drug users, the meth, those type of things. It's not really like your college student smoking pot or something. And then 17% are homeless only, 12% are illicit drug use only, 26%, a quarter of our cases are neither drug using or homeless, and I'll get to that. And then 12% are unknown, where, often folks are discharged from the hospital too early, and we're not notified by the hospital, or they're lost to follow-up, things like that. So a quarter percent being neither are, we're doing a much more detailed analysis into what makes up that group. We know from looking at a lot of our cases in general that a lot of them have a logical link to those who are homeless and or drug using individuals, meaning, we've had a case in a law enforcement person. We've had a case who deals with homeless. We had a case in a homeless service provider staff, a substance use provider staff, a volunteer with the church who feeds the homeless. But then we've had some cases in individuals who've just kind of, been around these populations, but not necessarily in working with these. We have had cases in healthcare workers who've worked, on the front lines with these folks. And so then but we've had cases, for example, at an auto body shop where an individual got sick, and then, there was a bathroom that was frequented by homeless individuals. And, he wasn't himself or herself, homeless or drug using, but then that individual ended up getting hepatitis A, and that's likely the link. But it's hard to say definitively. So then we have co-infections. So it's interesting, of the lab tests that we have from the people who had Hep A, we know that almost a fifth of them have hepatitis C. And that's important because of many reasons. One, hepatitis C or B, if you already have one insult to your liver and you get another one with hepatitis A, then you're more likely to have severe outcome. And the people who we're seeing who are dying of this all have underlying medical conditions, and many of them have underlying liver issues, whether it's hepatitis, cirrhosis, or other things. And they should already have been vaccinated because CDC has had guidelines on who should get the Hep A vaccine, and hepatitis B or C is the indication. But nationally, unfortunately, there's kind of poor vaccination rates in a lot of adults, including who are indicated to be vaccinated, including these groups. We have 30 kind of non-outbreak cases. This is kind of our background cases, number of cases. Most of these are travelers who go to countries that are more affected by hepatitis and then come back, and because that long incubation period they come back and they get sick here, and then we get them. And then we have a new strain that is new to CDC of hepatitis A. It's not the same strain as Mexico, for example, or Tijuana. It is not the same strain as even in Michigan's outbreak, even though it's a similar type of demographics that are affected. But our strain has been linked to cases in Santa Cruz, in San Luis Obispo, some other, we've exported a case to LA, and then Arizona, Colorado, Rhode Island, Utah, you see that. So there's a lot of, movement among these populations. And so unfortunately, it is going elsewhere as well. So this is our epidemiology curve where you see kind of the number of cases per week by across the year. And you see that we started, there were cases as early as the end of November, but these were coming in, just one or two at a time, the same amount that we would normally expect. And so then it wasn't, and I would note that we get the cases usually delayed because of delayed lab reporting, and which is different now because now most of the hospitals are calling us when they're in the ED so we can go interview them right there. But so then we found out at the end of February, we started, and early March, we started noticing this uptick was about twice as much as we would expect. And then we looked into those cases, of course, and they were different demographic, and we realized that we had an outbreak going on, and then immediately called the state and CDC because homeless individuals are not a recommended group to get the vaccine. So we had to make a local health officer recommendation that was expanded from what the CDC recommends because of what was going on here. And on March 10th, we put out our first health alert. And then, within the next few months, we started recommending also to vaccines for the folks who work closely and on ongoing basis with these populations as well. But as you see here, the number of cases escalated and then kind of plateaued here. And we think that, and CDC supports us in this, is that a lot of the vaccinations that when we do modeling that we do with the researcher at UCSD and with CDC, and that suggests that all of our vaccination efforts have really helped this from getting worse than what it is. But we definitely need to do more because it's still plateaued. It's not declining yet. It looks like it's declining, but that end, you see that red, and you don't have to be able to read it, but all you have to know is that is to take this stuff with this part with a grain of salt because of the kind of some of the delayed reporting and the incubation period. This is a map of kind of the cases by jurisdiction. And you see that all the cities with more than 5 cases, we label the number of cases, but you see Imperial Beach, for example, has less than 5 cases, so then we don't label the number just for confidentiality reasons. But but you do have more than 0 cases. So and then we have physically went and gone out to meet every city that has more than the 5 cases and talk to them about the outbreak, make sure they know where the homeless are in their community. We have a point in time map that we share with them. And we talk about, you all know your cities better than we do. And that data point in time homeless count is from January. So, we engage with the cities to say, okay, where are you homeless? Do they have access to hand washing, and hygiene opportunities? And if they don't have public bathrooms or things, then we put in a hand washing station. We can work with you. We recently put one in Imperial Beach. I don't know the location. So we've met with those cities proactively. Then last week, our chief administrative officer invited the city managers and/or your delegates to a meeting last week where we presented. A few of us were on a panel and we talked about also what we can do to engage with cities. So I'm happy to follow up if we want to talk further about, and we're trying to, there's a way that we can communicate with you all using what's called our web EOC, which your emergency managers all have access to, and to get information, get requests of where you're doing where you want hand washing stations. And then also we wanted to, talk about kind of, are you able to vaccinate your first responders, your folks who are more at risk, your code enforcement people who may be cleaning up after homeless individuals. And I would also encourage, if I love the Clean San Diego, if you're cleaning up after where homeless individuals are, we should recommend vaccination to you. So we had that city meeting on Friday, last week, and I believe there's one this Friday to have to share information. So in terms of our general management, we have a three-pronged strategy for this outbreak, and that's vaccinate, sanitize, and educate. And we just want to, focus on those three things. We know that vaccination is the best strategy of all these for these populations at risk. Not everyone needs to be vaccinated, and I'll talk about that in a second. But if we want to contain this outbreak, the populations at risk really need to get vaccinated. Sanitation, and I'll talk about all these three. And this just goes through some of the other work that we've done, including working at the federal level with CDC and HUD. I actually earlier we had a meeting with Housing and Urban Development. They were here on site. They fund a lot of the homeless service providers, and we have a regional task force on homelessness. And so if you do, and I'm sorry, I'm not familiar with do you have a large homeless population or not, but I would definitely encourage you to be involved in the regional task force if you do, and if you want to hear about some of the region-wide efforts. And so we had a meeting today with all the homeless service providers and made sure they knew what resources we have, and then talked about strategies, what challenges they were facing, how to put in systems to make sure that every individual that was going through was being offered the vaccine. And then we declared a local health emergency in early September, and we've activated medical reserve corps, among many other things. So across the county, there's been over 54,000 vaccines given for hepatitis A, which is significant. And this is all based on partnerships. No one can do it alone. And so, among some of the stuff that we've been involved in, we've given over 18, the county, we've been given over 18,000 vaccines. We've done a lot of things that are unique for us. We have our public health immunization clinics. We're used to people coming into our clinic. And, for this population that's mostly affected, homeless and drug using, they don't come to you. So you got to go to them. And then it's really hard what's so challenging is that you have to find them. Once you do actually find them, then many to most don't even accept it. And so there's a lot of education involved. There's a lot of trust issues. There's mental health issues that you're dealing with. And so that's why we rely on partners to give us those connections, because they might not trust us to give them an injection, but they might trust someone else, their homeless service provider. And then we have a lot of the police departments have hot teams, homeless outreach teams, and we work really closely with a lot of the homeless outreach teams to go out because they can take us places where we can't go otherwise, and for safety reasons. And then they know people, they're like, hey, what's up? And so it's a kind of a, it's a friendly exchange. And then we're going there, and then they understand that we're giving them a service as well. So we're doing foot teams where we're literally going out to encampments with coolers and vaccines. We have mobile vans. We go to clinics. We set up mass vaccination clinics at sites like homeless service providers. Again, your city. So if you have sites that we haven't gone to and you want us to go to, just let me know and we will figure it out. We'll work together and come to you all. We have staff. We've staffed up a lot. We've gotten temporary staff to help with this because it's been that much of a priority at this point. And then so the health systems we're working with routinely. We've had several meetings. Tomorrow we have a meeting with some of the CEOs of the hospitals to talk about really what they can do within their own walls and then outside of their walls to address this. Of course, the community health centers and pharmacies as well. And then more recently in August, we expanded the vaccine recommendation to food handlers. And that was for mainly because, as you see, a quarter of the population is not homeless and not drug using. And to protect that general population, right now it's not in the food, it's not foodborne, it's not transmitted by food. We have no evidence of that. But to try to prevent that, if we can get a lot of our food handlers protected, then, you can prevent it from getting in the food supply and possibly amplifying or propagating the outbreak. So, that's one recommendation that we recently made. Again, not a CDC recommendation. So we made that, and we've supported a lot of those vaccination efforts, including yesterday at a convention center, we had food workers. And then at-risk professionals, many of those include from the cities who are vaccinating their staff. And again, it's a comprehensive effort. We're working with EDs. They've never vaccinated before for hepatitis A or kind of any public health vaccination. And they're doing vaccinations now for us, and we're supplying them with the vaccine, training them, and things like that. And we're vaccinating the jails at intake. And we have 10% or so about of our cases are in the jails, or people who came in and out of jails. And so, these are places we have to go to where they are because they're not coming to us. Sanitize, I'm sorry, I'm taking up so much time. Sanitize, there's a lot of different things we can do. As you hear on the news, the city of San Diego, because they have so many encampments and everything, we asked them to sanitize their streets, and not just before they were cleaning their streets and, around the homeless individuals, but this was actually using a chemical that kills the virus. And that's in this case. But there's 300 chemicals that are EPA approved that kills hepatitis A. And I would recommend that anywhere where you have locations where homeless individuals and or drug using individuals kind of frequent, you want to make sure that your cleaning crews are using the right chemicals. And we have our environmental health department on our public website. We have kind of a 2-pager, but again, it's really just any EPA approved material used for that. And we go out there now when our environmental health inspectors go out to food restaurants and do their efforts with inspections, they're making sure that they're cleaning and using the right equipment, chemicals. And then we have hygiene kits that are available if you want them to use as incentives to talk to people about getting vaccinated, to the targeted at-risk populations. Like, we have hand washing stations. We placed one in Imperial Beach, but we can place more if there's a need. So just let us know. And I'd encourage you to look at also not just where your homeless are, but where they may access hygiene efforts and sanitation. And so if there's public restrooms that can be opened up for longer periods of time, specifically during this outbreak, then we would encourage that. If and if you need a hand washing station because you can't do that because and there's many reasons why you can or cannot and do that. And so we're happy to support with that. There is a list on 211. This is the picture of a hand washing station. This is the picture of them cleaning, sanitizing the streets in the city, and they're using the same vendor as LA is using, and they've been doing it for years. And this is the 211 website where you can see the hand washing stations in the bathroom. So next week when we give them weekly updates, you'll see Imperial Beach will have a water sign out there. So then in terms of educating, we're trying to, I think since late March or early April, we had our first press release, and then but in March 10th, we had our first health alert to providers. And so we've been doing several different news stories, press conference. We working really closely with 211 because they're getting a lot of the questions. And as I mentioned, we're meeting with cities directly, and we had our city manager meeting. We have another meeting this Friday, specifically focused on sanitation. And we are talking with healthcare providers. We had a meeting where for healthcare providers specifically, where they came and asked us questions, shared best practices, because these are different workflows than they've traditionally done, especially in the EDs. And then we're available for presentations. If any of your organizations, like I Love to Clean San Diego, wants one, we can come and talk to you all. And we have materials and resources. We have fact sheets translated in multiple languages. We have FAQs that we continuously update. I've gotten a lot of questions actually about the water, related to water. So we've added a lot about that. And so the next version will have one about Mexico, for example, and this being a different strain than what we're seeing in Mexico, and them having actually less cases this year. So we don't think there's an association there, and other questions like that. So we're continuously updating our material, and we're working with 211 to make sure they're trained to answer a lot of the general public questions. And so in terms of who needs to be vaccinated, really, our efforts are focused on this kind of targeted, defined population of drug users and homeless individuals, and then those who are working closely and ongoing around them. We did recently expand to food handlers, but really the priority is still those two groups of homeless and drug using individuals. The general public, a lot of people ask, should I get vaccinated? And it depends. One, the CDC criteria are such that there is a kind of a, I don't know about caveat or clause in there, but for anyone who wants the vaccine can go to their provider and get it. And they put that in there because there are other groups in there like, illicit drug users, there are men having sex with men, there are and other groups like that. And they knew that some people would not want to, say that they are in one of those categories. And so because of that, there's always been this thing in the CDC guidelines that anyone who goes to a provider and just asks for the vaccine can get it, and it should be covered by insurance. But that said, for this outbreak, really, for most of us who are not working directly with homeless or drug using individuals, doing what our moms told us, or dads, of just, really washing your hands with soap and water, sing happy birthday twice for 20 seconds, really helps you, because at the end of the day, you have to get it in, ingest it somehow. So if you wash your hands before eating, most of the time you're good. And after using the restroom too. So if you are working more closely with these populations, we definitely recommend vaccination. And so, how you get that depends on if you're insured or not, and where you're working. So if you're insured, we recommend you go to your private provider and get a vaccine through there, so we can focus our federally funded public vaccine on the homeless and drug using individuals, or those who are uninsured. A lot of the uninsured food handlers, for example, are coming to our clinic, or we've been going to them. So, and then we're continuing to educate. These are just some examples. There's public pool facilities where we know a lot of individuals spend their time. Food facilities, as mentioned, across the county. And then these are just some of our partners that we've been working with. But we have many, many partners, and it's really a citywide effort. And so, really, I'm here to answer any available questions that you have. And
Great. Thank you so much for that informative update. We take this very seriously. So I know Councilmember Must have a question.
So one of the things I know you heard us say that we were having a cleanup in the Tijuana River Valley. That is, we had one last week. We've got one on the 14th. These are people that are getting, they're getting into the dirt of these areas. I'm starting to think that these cleanups can be starting to be very dangerous for our people. And what does the county recommend? For those individuals, you said it's a different strain. I did hear that the one comes from Mexico, but we have had people that have gotten sick from the water in our community. So,
and the vaccine will protect against all strains. So, whether it's a different strain or not, or related to this outbreak, still, if you're concerned about anything from Mexico, it's still worth thinking about. But so is the cleanup after homeless individuals and kind of their,
the problem is
that, or are you saying
the
from the sewage?
The encampments in Mexico, get washed down and they pass over the border into our community. So I would say that there are homeless people that are probably in touch with it. Now, it may not have been, I know that it's a 30-day of a incubation period, but we've had spills that have happened recently. What I'm looking for is, would the county recommend that these individuals are going into the Tijuana River Valley to do these cleanups be vaccinated?
I think it can't hurt. This is a very safe, very effective vaccine. One dose, even if you give them one dose, it gets you 90 to 95% effectiveness. And there's no, you just need 2 doses, but you don't even one dose itself will protect them. But I think that,
How much is the dose? I think it's like $400
like 70 or something. Yeah.
Yeah. Okay.
But if it depends who's doing the cleanup. Is it staff?
Well, it's
staff? Is it?
It's actually run by the Surf Rider, Wild Coast, I Love It Clean San Diego, but it's got volunteers, straight up volunteers. So
got it. So then I would strongly encourage them, if they're insured, to go through their providers. If they're uninsured, to come to our clinics. But if they're cleaning up and to take this as an opportunity to remind everyone the importance of hygiene, really using, because I know when I've done I Love It Clean San Diego, they gave us gloves. They're very big on the safety, especially for puncturing or anything like that, and they give you those extenders, so you're not really contacting it as much.
Well, those are not these cleanups.
Okay,
people do use those little extenders, but they're getting dirty.
Got it. Okay, so I would say that anyone who's concerned, of course, can get the vaccine. But the primary thing is just using standard precautions, using personal protective equipment like gloves, and then washing hands.
They do ask that everybody come, but I think the right thing is to make sure that our partners are probably encouraging their people to have this vaccination.
offering it. Yeah, there's no harm.
And hand washing stations.
Yeah.
Right. Yeah.
Well, we can, if you want to make a public comment, I think that's fine. I just want to make sure let me focus on just finishing the questions there. And if you'd love to make a public comment, no problem. Okay. Councilmember Bragg, thank you.
Thank you. Thank you so much for this. This is really awesome. This is exactly the in-depth detail that we wanted. So thank you for providing that. Where is the hand washing station in Imperial Beach?
You can,
I hate to put you on the
Imperial, sure.
spot, but
you give me a minute after. I'm done.
okay,
I
sure.
look
You
it up
can
on
let
my
me
phone,
know.
I'm
And
sorry.
I wanted
Yeah.
to thank,
I remember it's next to 7-Eleven. I saw a picture. Yeah, you know where I'm. Yeah, I don't know.
on Second, you think it's on Mr. Patton, Councilmember? Okay.
I saw a picture. It's next to 7-Eleven, but I'm sure
Okay.
there's so many.
All right,
Yeah.
thank you. I wanted to thank our HR department, who has just done an extensive outreach to our employees about getting the vaccines here at the urgent care, up on Palm Avenue. So, Ms. Seha, thank you very much for doing that for our employees.
We provided the vaccine free for all employees.
Right.
Yeah, okay.
Right. And I just wanted to state that as our representative from MTS, from the MTS system, that those buses and trolleys are cleaned every night, but they have rearranged the solution ratio and are using a lot more bleach than they were. So I just wanted to state that, and I was very pleased to see that MTS immediately was on the ball with that.
Yeah.
And I got my hepatitis shot on Monday, along with my flu shot and
Right.
a cortisone shot. Kind of felt like a pincushion, but
A lot of shots.
I got it all, and
I would
other
say-
things.
I think you're bringing up two good points. One is, so like we did that at the county, where our HR department also, but we really went through, especially those most at risk who are working closely and ongoing. If you have to, figure out how to use your resources best. If you're available, it sounds like you're able to offer more broadly. So that's even better, but not all cities are able to. So I just want to commend you for that. And then two, with the flu, bringing up the flu, to put things in perspective, we had almost 7,000 cases of flu last year. I said, 481 cases of hepatitis, and we had 87 deaths from flu. So the general public is more at risk for flu, much, much more at risk for flu than hepatitis A. So just a good reminder. But those who are maybe more exposed because of whatever we're doing, should definitely also be concerned about hepatitis A. No problem.
Thank you for coming in. It was really instructive to me to receive your, I saw you talk at the Sandag meeting, because I think the impression of people in IB was that this is a San Diego, the impression I had too was the San Diego thing, and I saw the map. So I hope the council would agree. I'd like to direct the city manager to maybe develop an ad hoc committee among city staff and really make sure that in terms of Imperial Beach, we're the #1 city, and making sure that you feel good that we're doing all the best practices for preventing the spread. So whatever this city needs to do to really use this as a pilot project to make sure that we're clear on how we carry out disease prevention, let's do that. I think it's really important. And I think it starts with thanking Erica Cortez, like you already did. We're making sure that all our staff members had access to flu shots and Hep A shots. And what percentage of staff did we have?
I think Erica can come up and update us, but yeah, I want to repeat what the mayor said. Erica really put a lot of effort into this the last couple of days, and we really appreciate. She always looks out for the city employees. But I know she told me yesterday there were over 20 employees that came in and did it, and then there was another session this morning, and I don't know how many more came in. So good.
But in terms of our first responders, are we getting everyone to do that?
Yes,
So
our
lifeguards,
first responders for sure.
firefighters, our sheriff. What about sheriffs? Okay.
Yeah, we do. Sure.
So again, I just want to make sure that if you could create an informal work, maybe if that was this agreement, that we create an informal work group to make sure that we're working with our public works department and our business partners to make sure that we're doing everything possible, best practices, so the county can say, Ivy's got it. We appreciate the work you're doing. They get it. And then when another disease outbreak happens, we're prepared to figure out how to deal with it.
I would
Well-
include our churches too, because some
Yes.
of our churches are showering homeless. So that's a link there that needs to be covered as well.
Yeah, we felt like we should offer it to all of our employees because all of them spend most of their day here using public restrooms and whatnot. So we thought it was really important to offer that to all of our employees. So we did.
Great. Well, Mayor, could I just, sorry, just
Yeah,
one
no,
thing.
go
I would
ahead.
just say, you brought up businesses and churches. And so, many cities have mentioned they have a business license ability to send out blasts to a lot of the
All right.
businesses. And, making sure they have the sanitation guidelines and know which chemicals to use is really important.
Okay.
They're seeing
we
these
can do that.
individuals with these types of population. And then churches, absolutely. There's no kind of list of churches. So we've tried to reach out to whoever we can through our networks, but there's a lot of folks who are very good-hearted and want to go out there and help the homeless, and we want to make sure that they are aware of this, take the right sanitation and protective measures, and get vaccinated if they can.
Great. Well, thank you so much for coming in, and we will obviously follow up and make sure that we're a model city for dealing with this. Thank you. And then I know our other partner in this has been South Bay Urgent Care, and I know Dr. Matt Dixon would like to come up and say a few words.
Hello, thank you for having me. Thank you all for all the work you do. You do wonderful things for our city. My name is Dr. Matthew Dixon. That lovely lady is my wife, Dr. Kimberly Dixon. We're both residents of Imperial Beach, and we started South Bay Urgent Care up at the old Lydia's Cafe. So we definitely, as members of this community, as people enjoy the surf, public health is a big thing for us as well. Just want to encourage everybody to get vaccinated. We do offer the vaccine, both hepatitis A and the flu vaccine. One of the things, Councilman West, that you brought up is cleanups in the Tijuana River Valley. It is a sewage that comes down, and that is where hepatitis A is. And hepatitis A is a very hardy virus, and it can live for months outside the body, according to the CDC website. So it is something that I think should be addressed for the Surfrider Foundation, for your organization as well. So we do offer it at our clinic for insured people. I'd love to partner with you and talk to you before you go, is to get those uninsured people to have that accessible to everybody in the community. So the people that are uninsured, they could have it as well. So it'd be nice to have a place in our community that people could go to instead of having to go to the health department. They can walk or ride their bike. So.
Great. Thank you so much for the service you provided and all the other services you're providing for our athletes and community members on IB. We appreciate it.
Appreciate it.
Great. Yeah, thanks. Did you want to make a comment from I Love San Diego? Or? Great. Thank you. We appreciate it. Now we have another public health related topic, and that's the presentation of proclamation for Tijuana River Action Month, and Natural Resource and Environmental and Natural Resource Director Chris Helmer will give a presentation.
Yes, Mayor and Council. This is our 8th annual Tijuana River Action Month, and this city and City Council has supported every single Tijuana River Action Month. And remind you guys, we already talked a little bit about it already, the earlier presentation. But what it is, it's a month of concerted efforts to clean up and restore the Tijuana River Valley and Tijuana River watershed, both on the U.S. side and in Mexico. And this proclamation is an opportunity for our council to recognize the community members, the local community groups, the NGOs, the elected folks, and the agencies that are all involved in cleaning up and restoring Tijuana River Valley, because it really does take an effort from everyone. And this is an opportunity where we all do get along. And many of you on this council are actively involved and have been for many years on Tijuana River Action Month. So this proclamation will be given to the Tijuana River Action Network, and it just goes along with all the other great things going on.
Do you want me to read it? So proclamation, whereas October is Tijuana River Action Month, whereas the city is dedicated to improving the water quality and environmental habitat of the binational Tijuana River watershed. Whereas clean beaches and the health of Tijuana estuary is a priority for the city. Whereas the Tijuana River watershed provides important ecological and recreational resources to South San Diego County. Whereas the health and well-being of the South Bay community is directly connected to the health of the Tijuana River watershed. And this month of October recognizes key efforts and investments by public and private agencies, nonprofits, and community groups to protect and restore the Tijuana River. So I, Serge Gina, along with the City Council, together with the City Council, do hereby recognize the month of October as Tijuana River Action Month. Thank you very much. We had, great, if you want to, we have Ginger, you wanted to make a comment? Do you have a question? Did you have a comment, right? Okay. I'm sorry?
This item.
Oh, okay.
Yeah,
Good
it's like
time.
3 different topics on here.
Okay.
Ginger Sacco, 1390 Santa Alicia Ave, 15106 Chula Vista. So since the last time I've seen y'all, it's been like a month. Well, Serge, you've been gone, so welcome back. We missed you last time. Let's see, I've been around. I met with Senator Ben Hueso and Congressman Juan Vargas, and I got to hear about the new bill that's coming out, 3795. We were really excited to hear about that. And apparently there's going to be a sister bill coming out shortly thereafter, so that should be hopefully soon. We also got, Citizens Against Sewage, got to meet with Stephen Padilla at Chula Vista prior to the press conference. Ironically, he couldn't get rid of us fast enough, which was really sad because he's my council member, my district. I've been to Chula Vista City Council and Coronado City Council. I've spoken at both. I don't know what it was about Coronado, but I actually cried at the podium because I shared a story about my son. I was listening to your story about your son. My son has heart problems, for anybody that doesn't know. He had open heart surgery, so he can't play in the water. Surfrider recently started testing the water. Gabriela Torres, I can't remember if it was a week ago or 2 weeks ago, but she started doing that. As you all know, Port of San Diego has joined us. And the reason I'm really excited about this is Citizens Against Sewage, our goal is to have 5 entities unite, which is Imperial Beach, Chula Vista, Coronado, San Diego, and National City. I can't get National City to respond to us for nothing. It's like cockroaches over there. They're gone. We can't find them. But we got Port of San Diego, so we're pretty excited about that. So that was a bonus. So I think we're going to have to start busting down doors over National City because we can't respond to them. So we're really excited that we got 4 out of 5 that we wanted and a bonus. So hopefully next time we meet, we can hear something from National City. So we're really excited about that. We've still been working with Senator Feinstein, like you said, and Congresswoman Susan Davis. And yeah, that's it. Thank you so much.
Great. Thank you so much. Any additional comments on that? I had a comment. I was in the River Valley on Saturday riding my bike through it. And it's 12, more than, I think it was 2004, obviously well before I was mayor. We work with the city of San Diego and then the county ag department on cleaning up the illegal equestrian facilities in the valley and doing best practice management workshops for the equestrians. And obviously Trivia and the folks that have, outstanding equestrian facilities do a great job. It seems to me from my amateur review is that it seems to me some of those problems are back. So I did notify the Humane Society officer about if he could put us in touch with a person that does works with horses and horse ranches to see whether or not maybe I'm wrong. But the other thing I did notice is that, we've made a great practice of cleaning up blight and empty lots in the city, but apparently in the River Valley, it's just a garbage dump. And that's not including the river channel. I'm just talking about the privately owned lots that are filled with debris and garbage, and whatever goes seems to go there. So I was hoping that our city could take the lead in following up the county ag department or our county supervisor, as well as the city of San Diego code enforcement department, to see if maybe we could meet and figure out how we can approach that issue. Because everything upstream obviously impacts us, but it just, it seems to me there's a lot of, anybody who wants to do anything in the River Valley apparently can just do anything they want and build anything they want, throw garbage anywhere they want. There's reports of dogfighting going on and cockfighting going on as well. So that's something that happened, I think, more than 10 years ago. They busted one of the largest cockfighting operations in California history. But so that kind of illegality, just also apparently there's a lot of garbage dumping going on as well, and potentially hazardous waste. So I think we need to make sure that when we file lawsuits against the federal government for things that are coming out of Mexico, that we're also walking the walk and talking the talk on the U.S. side of the border, and that our agency partners are making sure that they're impeccable in how they carry out their own operations. So it was a very positive and proactive process last time, because the guys who were doing the operations the right way were really pleased that the illegal ranches were being shut down. There was a place called Garage Door Tijuana that literally was stables made out of garage doors. The horses would stand on top of the garage doors. You'd see the horses on like a second floor of a, people actually thought they were in Tijuana when they drove by. was right across from the community garden. So that seemed to me that's come back. But right near the ball fields, the Southwest Little League, it's a free for all. And the reality is lots of kids and people carrying out activities there, but all that manure and all that garbage just washes downstream. So anyway, great, thanks. I want to thank Chris Helmer and our entire public works staff, our lifeguards, for all the work they do to help foster and promote the cleanup, obviously, Surfrider and Lake Police San Diego, all the work you're doing. It takes a lot of work, but we've got to engage a lot more partners in this to be a lot more effective and achieve it. So, and I like the idea that our city, whether it's in public health or environmental protection, is modeling best practices, and that we're always setting the standard, the bar the highest, and saying that regardless of what we're doing, we need to make sure that we're always doing the best possible job so that we're a great role model for other cities. And all right. Great. With that, we have the consent calendar. I would like to entertain a motion to approve consent calendar item numbers 2.1 through 2.7.
Second.
Please vote.
Motion carried unanimously.
Great. Now we have another issue. Ordinances. We have introduction item 3.1, introduction and first reading of ordinance number 2017-1167 and adoption of resolution number 2017-7856, giving notice to the Board of Administration of the California Public Employees Retirement System, CalPERS, of its intent to amend the city's retirement contract to include cost sharing for classic, miscellaneous, and safety lifeguard members. Human Resources Manager Cortez will give the report. Thank you.
Good evening, Council. Thank you. In an effort to address the pension cost through labor negotiations, recently Council approved the MOU, and therefore, as part of the MOU, this item before you is to approve a resolution of intent to send to the CalPERS Board of Administration, letting them know that we would like to amend our retirement contract to do cost sharing 50% for labor negotiations with our lifeguards, tier 1 and tier 2, that's for classic members, and our miscellaneous employees, tier 1 and tier 2. Now, obviously, this is in relation to the labor negotiations, but CalPERS classifies appointed management and confidential employees under the miscellaneous, so that also applies to them. So I just wanted to clarify that this is only not for the labor group. So in order to do a cost share contract amendment per Government Code 20516, the CalPERS has specific guidelines and procedures that we have to follow. And this is what we have tonight, which is the resolution, as I mentioned, and the first reading of the ordinance. The resolution will be sent to CalPERS and follow the resolution. Tomorrow, we're going to have an employee election. It's a secret employee election for those that are in those tiers 1, tier 2, and both of those groups. And then the second reading or final reading of the ordinance will come before you on the November 1st. And after the ordinance is approved, the contract amendment will take 30 days effect, after the approval. It's approximately in December. This information is actually, like, it's a lot of data, like how many tiers we have and the percentage. So I went ahead and prepared the chart that you have on your screen. It's also addressed in the staff report, but I just thought it would be easy to give you at glance what are we talking about in terms of the changes. So with that, if you have any questions, I'm more than happy to answer.
Questions, comments? I wanted to thank you for getting a handle on this. Obviously, retirement benefits and pensions issues are affecting the entire state and our city as well. So the burden of our pension is just huge. So thank you for slowly working on this and trying to get a handle on this. I know we appreciate it.
It was a team effort between the labor groups, our labor management team, assistant city manager, and Doug Brelly. So I don't take all the credit. So we appreciate it.
We appreciate it.
No.
Great. Did you, yeah,
I just wanted to say also that, all of us have followed the progress of the discussions to get to this point, and you all have done a great job. And I also want to commend our employees for the great work that they're doing, for the city. And I know that all of us on the city council want to be as fair as we possibly can to our employees, and we feel we've got great employees here, and this is a great place to work. And we hope that this all goes through very smoothly.
Yeah, absolutely.
Great. Thank you. With that, I would like to entertain a motion to adopt resolution number 2017-7856, giving notice to the Board of Administration of CalPERS of its intent to amend the city's retirement contract to include cost sharing for classic, miscellaneous, and safety lifeguard members. City Clerk Kelly will read the title of ordinance number 2017-1167. You need to read that, right?
Mr. Mayor, we're taking two separate motions. The first one will be the resolution that you
Okay.
just mentioned.
Oh, okay. So, right, is there a second? Great, thank you. Please vote. Are we voting on that, or? Okay. Oh, I'm sorry, you're right.
Wait, I don't think.
But that was, we were voting on resolution 2017-7856.
Right.
Yeah.
And you made the motion.
Yeah.
Motion carried unanimously.
So now we have the second ordinance. That's my fault. City Clerk Kelly will read the title of ordinance number 2017-1167.
Ordinance number 2017-1167, an ordinance of the City Council of the City of Imperial Beach, California, authorizing an amendment to the contract between the City of Imperial Beach and the Board of Administration of the California Public Employees Retirement System, CalPERS.
Now, I would like to enter a motion to introduce and conduct the first reading of ordinance number 2017-1167 by title only, waiving full reading of the ordinance. Second. Please vote.
I was a little slow with the buttons. Sorry,
Revote?
Want to revote?
Mr. Mayor, can we do an oral vote, please?
Please vote. All in favor of?
Aye.
Please. All opposed?
Motion carried unanimously. Thank you.
Okay, now we have another, 3.2, okay. Sorry. Item 3.2, introduction to first reading of ordinance number 2017-1166, an ordinance of the City Council of the City of Imperial Beach, California, amending Title 8, Chapter 8.84 of the Imperial Beach Municipal Code to regulate the use of electronic smoking devices. City Manager Hall will give the report.
Mayor and council, in light of time, I can keep this real simple. What we are doing is asking the city council to amend the ordinance or to introduce an ordinance that would amend the definition of smoking to include electronic cigarettes. Therefore, electronic cigarettes would be treated just like cigarettes, and they would not be allowed any place that that smoking is not allowed. Pretty simple, but if you have any questions, I'm here to answer them, but that's essentially what we're doing.
Questions, comments? Any speakers?
No, Mr. Mayor.
Great. City Clerk Kelly will read the title of ordinance number 2017-1166.
Ordinance number 2017-1166, an ordinance of the City Council of the City of Imperial Beach, California, amending Title 8, Chapter 8.84 of the Imperial Beach Municipal Code to regulate the use of electronic smoking devices.
Great. I would like to entertain a motion to introduce and conduct the first reading of ordinance number 2017-1166 by title only and waive full reading of the ordinance to regulate the use of electronic smoking devices.
Second.
Please vote. Thank you very much. And now,
Motion carried unanimously.
great. And now we have item 5.1, which is resolution number 2017-7857, accepting funds for Coastal Trail Major Mile Marker grant and installation at Pier Plaza in cooperation with Coastal Conservancy staff. Management Analyst Via will give the report.
Thank you, Mayor Dedina. So the Coastal Conservancy is trying to promote and complete the California Coastal Trail, which is about 2/3 complete. A little more background for those that don't know, the Coastal Conservancy is a state agency that was created in 1976 to protect and improve natural land and waterways, to help people get to and enjoy the outdoors, and sustain local economies along the length of the California coast. Back in 2001, the California Coastal Trail was declared an official state trail, and legislation was introduced to do a focused effort to complete the trail. The Coastal Trail is envisioned as a 1,300-mile hiking trail from the very top of California all the way down to the Mexican border, 1,300 miles along beaches, bluffs, roadsides, through cities, forests, sand dunes, etc. The Coastal Trail Major Mile Marker Program is new, approved by the Coastal Conservancy Board in May 2016 to promote the Coastal Trail. To get an idea of the size of these major mile markers, here's a picture of the Coastal Conservancy Board in Laguna Beach celebrating the pilot program, installation of the coastal marker. Their goal is to have at least one in every coastal county, and in some counties as many as 3. Oceanside is receiving one of the coastal markers. Their city council just approved it, and hopefully Imperial Beach will be the second one. The design was created to generate excitement about the prospect of being able to hike and bike along the entire length of the coast by indicating distance to Oregon and Mexico from each of the coastal markers. This project will promote access and enjoyment of the coast by heightening awareness of the California Coastal Trail. The city manager was directed to modify the design a little bit for Imperial Beach. So, per Councilmember Patton's request. Okay. While they're looking for parts, while they're looking for parts of the trail that have already been paved, and Imperial Beach's section is actually on the sand, they think Pier Plaza would be a great location for a coastal trail marker. From YMCA Camp Surf through Imperial Beach down to the Mexican border is about 4.1 miles. You may remember the Coastal Conservancy Board visited Pier Plaza in connection with the Mojo Coast Walk in August of 2016, where Morgan, Mo, and Josie Joe completed a 1,200-mile hike from the north end Oregon border down to Mexico in 96 days. So approval of Resolution 2017-7857 will allow the city to accept funds for a coastal trail major mile marker and authorize installation at Pier Plaza in cooperation with the Coastal Conservancy staff. They're on the cusp of creating an app, and they're doing a lot of advertising. So this would make Imperial Beach like a big hiking coastal trail hotspot.
Great. Any questions, comments? That was a great presentation, by the way. Really, really good. I really enjoyed that. And I was obviously, I'm in that photo.
Really?
No. Somewhere. It was a really nice day, and the women were really, really outgoing and really excited about having ended their walk in Imperial Beach. They had a really nice lunch at the pier. They all got IB hats. I walked with them to the border. Our lifeguards helped facilitate their crossing the Tijuana River. It was a really, really nice day, all within Imperial Beach, because all of us know that the end of the California coast all belongs to IB. It's in our city. And so I'm really looking forward to this. Hopefully we can approve it. But yeah, it's really nice. I'm really glad that we're going to see lots more people making, arguably, and all of you know, some of the most beautiful walks you can do in Southern California are on our beach, whether you go north or south or walk along our beachfront. Every time I do that walk, I love it. And it's great. It's really, really an adventure every time you walk south of our city or north. So anyway. Great. And with that, I would like to entertain a motion to adopt resolution number 2017-7857, accepting funds for Coastal Trail Major Mile Marker grant and installation at Pier Plaza in cooperation with California Coastal Conservancy staff.
Second.
Great. Please vote. All right, moving all right along.
Motion carried unanimously.
How we're moving along. 5.2, authorization to enroll the City of Imperial Beach in San Diego Gas and Electric Eco-Choice Program, ensuring that all electrical power at City Hall is generated from renewable resources. City Manager Hall will give the report.
Mayor and Council, again, in light of time, just a real quick introduction, and then we'll have our nice friendly neighbors from SDG&E come up and give us a presentation. But I'm pretty excited about this. The city council has made it clear, not only with a lawsuit, that we're worried about sea level rise because of some of the effects that carbon has had on our community, but just in general, the right thing to do is to try and generate power with renewable resources. I'm pretty excited that I believe we're going to be the first city to enroll in the Eco Choice program in San Diego County with SDG&E. So this is pretty exciting. One of the things that I'm glad to report is that it's not very expensive. And you'll see, they're going to give a presentation. It's not very expensive for us to make sure that all the power that's used here at City Hall is coming from renewable resources. And that's pretty exciting. And I'm glad that we're, again, stepping up to do the right thing and always trying to do the right thing by the environment and by our community. So with that, Vanessa Malcoa Garcia who you all know is our liaison with SDG&E, and they'll talk a little bit about the program, and we're really excited to be the first ones out of the gate.
Well, that's coming on board. Thank you, Andy, and Honorable Mayor, Vice Mayor, Council members. I'm really excited to introduce this program because, as Andy said, Imperial Beach is always trailblazing between clean beaches and water, transit, electric vehicles, obviously schools, and when the council member gets back, of course, local sea level rise. So as this is coming on board, I'm here to present the opportunity to be 100% renewable for City Hall. The program called Eco Choice was a recently approved program by the California Public Utilities Commission that basically enables residents, businesses, and community of all sorts, including municipalities, to offer 100% renewable energy. So just to kind of explain a little bit about the mechanics of it, SDG&E is at 43% renewable energy already. The state mandate is to achieve 50% renewable energy by 2030. SDG&E is already poised to receive 49% renewable energy by 2021. So you can see we're already well ahead of schedule. And then similar to the city's leadership, we really wanted to make sure that we brought this to you first and foremost as an opportunity to have that 100% clean energy similar to SDG&E. The energy would be, our 43% is derived from wind, solar, no coal contract. And it allows, I'm kind of stalling, but no, you don't have it.
You're doing a great job. So
We'll go with
I
that.
wouldn't worry about the
So I'm gonna
technology.
extend
You're
upon
doing
our letter.
perfect.
If
So
you might have your letter in your packet, I'll refer to that.
They do.
Yeah.
They do have the chart in their packet. but
No
let me get-
problem. So how the program works is typically businesses who we are engaging in the city of Imperial Beach already to enroll can elect to go above and beyond. So those stewards that really have that interest, as Andy said, to go above and beyond in their renewable energy choice can elect to do so at a 50, 60, 75, 100% level. It's really a click of the button on their account tool. Now, SDG&E was authorized to do about 59 megawatts, which would probably achieve about 33,000 homes. It's a pilot program that we're doing that is basically launched in response to much of our constituents' goals to do more, basically. And so what we had proposed today to the council was the opportunity to do 100% renewable for City Hall. Oh, there you go. So this is the opportunity to 100% for City Hall. Not necessarily the PowerPoint. You can see the numbers as vividly on the PowerPoint, but what this shows is the average monthly bill taken from last year's productivity in your energy account would be $1,400 a year. So roughly about $115 a month. It's about a 3.4%, if I recall correctly, bill increase. What the benefits would be for City Hall, obviously you would choose your 100% renewable energy choice and you would have those contracts. They would be new contracts, local contracts that would be built. We already have about a 20 megawatt contract coming online very soon in Imperial Valley. You would be able to reduce your carbon footprint. So this would add to and complement your goals that you're now working on with the Sea Level Rise Plan and the Climate Action Plan. Obviously, all of the projects, as I mentioned, would be local, so they remain in our service territory, and that creates more green jobs and an infusion of more of that green economy that we all are so intimately involved in Imperial Beach. And then obviously we're supporting renewable energy developers, so that's a big commitment that we all have. This would take effect almost immediately in Imperial Beach. It would probably come online at the end of the month of October, as soon as that hits your bill. And I wanted to to just kind of leave it open to any questions that you might have about the program or anything else. I'm happy to help. And I have a great team here, my director of regional public affairs and our clean energy plan manager who is working with IV on the sea level rise plan, and our municipal contract manager.
Great. Thank you for that great and brief update. Questions, comments?
Sure.
Over time, what do you see the cost? Is it gonna go
That's a
up,
great
go
question.
down?
That's a great question. So in enrollment, there is a 60-day grace period, more or less. Enrollment would kind of lock you in for about a year into something like this. Obviously, these rates are based upon your last year's usage, so it's about a 3.4% that would go into effect based on your usage, each month after October after enrollment. If you chose tonight, obviously, it would be after October. And so next year, I don't necessarily have a trend as far as what would happen, but we all know that the cost of renewable energy is going down. So I hope that kind of supports your question a little
Yeah,
bit.
definitely. This is kind of like the baseline, and
Yes.
then kind of
Yes, after a year, you can, choose. This would be a 1-year opportunity with a 60-day grace period if you chose after a couple months something happened.
Councilmember Bragg. Thank you, Ms. Pratt.
Vanessa, thank you so much for being here, and especially a thanks to SDG&E for supporting the community of Imperial Beach and Olive and especially this event. You've always been a sponsor of that, so thank you for that. I do have a question about the program. Why was the Dempsey Holder Safety Center not included and Public Works not included?
That's a great question. So we did discuss that at length with city staff and whatnot. The Dempsey Center is actually under the account of the Port of San Diego.
Okay.
So we did look into that. I think that was another question that some of the council previously asked us to do. Public Works Yard, I think, was kind of left out because this was more or less a goal to be, it's your more iconic building. And I think that you guys have some future perspective opportunities for Public Works. And so this was more of, this would be the most symbolic for the city.
Okay. Thank you. I wanted the audience to notice our new windows here, and I'm going to call on Andy is not here, Mr. Hall is not here. I'm going to ask Steve to maybe talk about the cost savings of these new windows that have been installed here at this building and then the building next door as well, if you would. And I also wanted to note that we do have here at City Hall a new water bottle refill station. So we are trying to cut down on the numerous plastic bottles that are generated. So if you have a plastic bottle, reuse it. If you want to refill it, cold water, come to City Hall. It's right in the hallway. You can have access to it. So, Mr. Dush, if you could answer the question about the new windows here at City Hall and the potential cost savings in those. If you would.
Thank you, Mayor Pro Tem Bragg. The new windows are not only installed for this building, but they'll be installed in the building where the sheriff is located as well. And so they're going to continue to wrap, every window here. They are double pane windows, unlike the single pane before. And for those of you who've been in this building or in this room before, you'll notice that it's much, much more quieter. So that coupled with the energy efficiency, we feel that it will certainly offset the cost that the Eco Choice will do. So we'll certainly do some accounting and track that to see what that looks like. The variability really depends, so we'll take a look at that. But just anecdotally, the sound dampening alone, I think is a vast improvement. But then again, the energy efficiency that these windows will offer from the old ones, that's actually one of the most efficient things that you can do for a building in terms of its energy efficiency. We talk about, heating and air conditioning systems. Windows is actually the #1 thing that you can do for energy efficiency. So we're pretty excited about that.
Great.
Thank you. Do you have more questions? No. All right, Mr. West.
Vanessa, thank you so much for making this a reality for us. And we haven't voted on it, but I'm pretty excited about it. But I also want to thank SDG&E for really many cities tout that they have climate action plans in our communities, and most of them don't even tackle the biggest problem that we have here in California, which is really the transportation piece. And I really, really, really thank SDG&E on trying to roll out these more electric car charging stations, because that is the gorilla in the room in many ways that we're not dealing with on so many other climate action campaigns. And I appreciate SDG&E moving
well above, you're at 43% now, and I've seen the numbers that you're going to be well below, well above 50 very soon. So thank you so much. That's all I got.
Great. Mr. Sprague.
Thanks, Vanessa. Good to see you.
You too.
And thanks for the presentation. I guess I'm just as delighted as everybody else that we're going in this direction. I mean, this is our whole MO in Imperial Beach is, environmentally astute and smart, and clean energy is a big part of that. And we're working on a climate action plan, as you know. What I was actually wondering is, could you elaborate a little bit more on why the actual cost is going up a little bit? What some of the background is for that? And kind of related to the question that was asked by one of my colleagues about when you think it's going to come down. So that kind of lends into that as well. And the second part of it is, if the city wanted to explore rooftop solar, for example, would SDG&E potentially be a partner in that as a way to bring our better achieve maybe more quickly achieve our climate action objective? Thanks.
I'll answer your first question first in terms of the cost. So we are authorized to go above and beyond, and probably what I didn't highlight is that this credit stays with the city. This is not an SDG&E credit. This doesn't add to our 43% renewable energy or getting to the 50% renewable energy goal. This credit would be yours. And so as a result of that, what we're doing is we're building more renewable energy projects. Those 59 megawatt projects actually have to get built. And so the cost is kind of attributed to that. If we were to say, hey, we're going to provide renewable energy for the entire region, the cost of everyone's energy would certainly go up to produce those contracts, to produce those projects, and to basically construct them. So that's a little bit of why that cost is reflected there. And then we obviously put the energy to market and whatnot. And so some of the price fluctuates due to that, due to the market.
So there's a sort of built-in capital cost that's being paid off over a period of time that's structured into this cost.
Yes.
Structure. Yeah.
Yes. And please correct me if I'm wrong on that. Yes, it's all a pass-through. So thank you. Now, in terms of your second question, in terms of being a partner in solar, SDG&E is a big proponent of solar. We love solar. So this renewable portfolio status, any rooftop solar is actually an additional benefit to that. A lot of, as Councilmember West brought up, we have a big platform to do transportation electrification, a big energy efficiency platform. We're already working with your public works director on some energy analysis that will kind of help citywide efforts, in addition to some of the weatherization that you've seen here. And in terms of, the direction that we're going, you'll see a lot more conversation on energy efficiency and also zero net energy coming forward in the future. But the investment of solar, we will fully support you to, put solar in terms of to connect you and interconnect you to the system and help you with that process. But SDG doesn't necessarily install solar, if that helps. So we will certainly be a partner in the effort and endeavor.
Great. Thank you very much. Thank you so much for the presentation. Wild Course, the organization I run, I think we did Eco Choice right away. And then I think in my house, I'm pretty sure we did it as well.
Yeah.
So that's great. I should know that. And I think I do. Anyway,
Your wife
I'm in charge of everything. I know everything. First of all, I'm going to thank city staff for moving on this. In theory, it should have been done 50 years ago, but I'm really glad we finally got it done. And then this whole energy analysis of our entire city, I like the idea because at the end of the day, it saves our residents money. It saves the city money. So I think that's where we're going. And yeah, we just need to upgrade these old buildings. Yeah, we're leading by example. So I'm really pleased with this. So anyway, I'm sorry. Exactly. Right. There you go. So anyway, with that, I would like to entertain a motion, direct staff to enroll in the SDG&E Eco Choice program, ensuring that 100% of the amount of electricity used at City Hall is generated using renewable resources.
Second.
Please vote.
Motion carried unanimously.
All right, for something now really fun. Number 5.3, informational discussion regarding commercial cannabis activities. Assistant City Manager Dish will give the report. Thank you. Thank you so much for coming. Appreciate it.
Thank you, Mayor, members of City Council. This evening is an informational discussion about commercial cannabis, and the purpose, as stated here, is to provide an overview of the state cannabis laws and the impacts upon Imperial Beach. We'll also discuss the extension of the moratorium for another year that the city has in place, and also or an authorization to conduct further research related to the issue, and we'll talk a little bit about what some of those elements look like. So just to ground everybody, to provide the background, back in November of 16, Prop 64 passed, and what that did is it legalized in the state of California the adult use of recreational marijuana. In February of 17, the city had adopted a temporary moratorium, and then in March extended that moratorium, which goes through February 1 of 2018.
And
So
to make sure that's a moratorium on commercial facilities.
that is
Right,
correct.
okay.
Yeah, and I'll talk a little bit about
Make
what
sure
what
the
that
public-
did.
For the public and those watching, they understand that.
Right, absolutely. Thank you. So the existing moratorium prohibits the non-medical marijuana activities. So the city may evaluate these impacts from a land use perspective. There are no impacts to the existing medical marijuana provisions that are in the city ordinance. There are no impacts to the personal use, possession, or indoor cultivation of marijuana as allowed by Prop 64. In March of 17, the city council formed an ad hoc committee comprised of Mayor Pro Tem Bragg and Councilmember West, and then city staff to evaluate the land use considerations of the various cannabis uses and permits that are outlined within the state enabling legislation. The ad hoc committee had conducted an at-large meeting, and staff also presented to the IB Chamber of Commerce and the Business Improvement District folks. And staff had also met with proponents who had reached out to provide their comments. As the ad hoc had continued to meet and research and trying to establish a better outreach process, because some of the input that we received, while very good input, we were looking to reach a larger audience. And as we were looking at establishing a methodology in order to achieve that, in June of 17, there was SB 94, which came out, and that combined the recreational and medical licensing provisions into a single regulatory scheme, because some of the language in the medical marijuana state enabling legislation conflicted a little bit with the adult use or the medical marijuana, or excuse me, the recreational marijuana as in Prop 64. So that is known as, and this is a mouthful, the Medical and Adult Use Cannabis Regulatory and Safety Act. And so that is on the books as well. And then a month later, as again, the ad hoc was trying to figure out a way to do some better outreach and reach a larger cross section. There was a citizen initiative that was filed in July, and Imperial Beach was one of 7 cities within San Diego County that citizen initiative petitions were sort of executed. And so we'll talk a little bit about that as well. So I'm going to hand part of this over to our city attorney, who will talk a little bit about some of the initiative, the process overview, and some of the options that we have, and then we'll bring it back.
Thank you. So yes, the initiative that was submitted by the Association of Cannabis Professionals proposes to create new commercial uses in Imperial Beach related to marijuana. Specifically, it would authorize marijuana retailers, cannabis consumption lounges, and marijuana manufacturing sites. There are no size or number restrictions on these, and they would be in, 2 of the uses would be in the mixed use commercial zones. The marijuana retailers as well as the consumption lounges would both be permitted in the general commercial and mixed use and the Seacoast commercial and mixed use zones. The initiative proposes manufacturing sites would be permitted only in the general commercial and mixed use zone, CMU1. The proponents of the initiative are requesting a special election. And for a special election, you would need to get 15% of registered voters within the city of Imperial Beach to sign the initiative. If they get at least 10%, then that would be a general election. So the date of any election, if they got the signatures that they needed on the proposition, would depend primarily on how quickly they gathered them and when they submitted them to the city and when the signatures were actually certified. The city clerk obtained an estimate from the registrar of voters of the county, and looks like a special election would cost the city in the range of $250,000 to $350,000. If the signatures were submitted in time to make consolidated with the June primary, the cost would be substantially lower. It'd be somewhere in the $20,000 to $45,000 range, but we don't have any, we don't control the timing of when signatures are gathered. So the elections code, when there is a citizen initiative like this, the elections code kind of dictates the process, and there's these steps. If they do gather the required signatures and they are verified by the county registrar of voters, the council will have a few options. One option is to essentially just submit the initiative to the voters. In that case, if the initiative is approved, it's just a majority vote of the voters on this type of initiative. Then the city would not be able to modify any, if it was approved and it passed, the city wouldn't be able to modify the provisions without going back to the voters. The second option is, instead of putting it out to an election, if the required signatures were certified, the council could just vote to adopt it as is, and that would save the cost of the election. But that would also mean that, again, you couldn't change, just as if you had submitted it to the voters, you wouldn't be allowed to change it without going to the voters. Another option for the council to consider, and this is something that the council did explore last time there was a citizens initiative, was the idea of submit a competing ballot measure if the city council were in a position to feel that there was a different measure that they would like to put before the voters at the same time. The council did explore that last time, but didn't end up submitting a competing ballot measure in 2012. And then the other option would be to consider adopting, because the city had already established an ad hoc and started investigating this issue, the other option would potentially be to consider adopting some regulations before the signatures were obtained on the initiative. And if the proponents were satisfied with those regulations, maybe they would not continue to proceed in that fashion. And then there would be regulations in place that would allow some type of facilities that the council would adopt. So those are the kind of the options, and I will hand it back over to the assistant city manager at this point.
Thank you for that update. So we have some public comment here, and then, so there's two issues. There's, I'm sorry, you done?
Yeah, I was just going to close with, summarizing
I'm
this
sorry.
is just to, the recommendations are to request the city council to receive staff direction, whether you want to extend the moratorium, because as you know, we'll need to come back in November and do an ordinance on first and second reading. And because of the way that the schedules are, that's why we're coming to you now. So we get that direction so we can prepare those ordinances if that's the desire of the council to put that on your agendas in November. We're also seeking the authorization to the city manager for up to $65,000 to review the initiative options and issues, exploring things such as, again, doing some field work, looking at what other communities are doing, whether it is investigations on site at other locations, whether it's some survey work, or meeting with, let's say, the proponents, as Jen had indicated, and trying to come up with an alternative that could ameliorate or address some of the need to have an election. And the third one would be to either direct the city manager or the city attorney to provide some additional information and options. So with that, we've concluded.
Great. So we have public comment. I'd like to do that first, and then the council can ask questions of staff. It seems to me, just to make sure I'm clear on this, where there's two issues. There's our own process, which we were moving along. But I was actually really happy to see the progress that had been made. And number two, the proposed potential ballot initiative. So we have two things we're weighing with, in addition with potential funding issues or providing funding support, and a potential moratorium. So anyway, with that, Mr. Boyd, Marcus Boyd.
Good evening, Mr. Mayor, City Council, City staff. Thank you for the opportunity to give public comment. As some of you may be aware, the prior ballot initiative, Citizens Initiative, was spearheaded by myself. I attempted to work with the City Council for years prior to that, to no avail. I'd like to remind the council members that were here and the ones that weren't, that the reason that the last competing ballot initiative was pulled by the council was because when it was provided to the public 45 minutes before the council meeting, it was read and discovered that it had a poison pill. It indicated that the collective had to grow the marijuana, and then it also indicated that the collective could not grow marijuana. I'd also like to remind the staff that the city officials, specifically the mayor at that time and the prior mayor at that time, which was a council member, went through great lengths to prevent the citizens of Imperial Beach from having a town hall meeting at any location that would facilitate in the city. That included the library, Dempsey Hall. All the locations that should have been made available to the public were prevented from hearing this matter. I would urge the council to give this initiative, this issue, an earnest look, one that is not hampered by poison pills. And in light of that, I'd like to say that though there was public comment that was done by the ad hoc committee, what wasn't discussed today was the results of those meetings. And when it was presented to the general public, there was quite a bit of pushback from the public with regard to how the city did it. The city at no time during the presentation offered to the public that there were several different types of licensing that could be available. They presented the entire subject matter as though it was going to be a storefront operation, which is considerably different in land use than would be a testing facility or a manufacturing or a packaging facility. So I would like you to know that this current process is going down the same road as the previous process, which was one of obstruction and a lack of transparency. I urge you to seriously and earnestly consider this subject. Thank you.
Okay, I'm going to make sure I'm clear. Just so first of all, we're not reporting on the results of the ad hoc committee because I think the issue with the ballot initiative came in, we had a process. And so I'd like to have that come back at some point, but I think we're trying to figure out where we're at on that process. This is the first I've heard. I wish in the future, please contact us if you're unhappy with the process so we get some feedback.
The city was informed and there were council members present.
Anyway, you're free to always contact us just to let us know. But number two, so I'm going to make sure you were the one that wanted to ask this initiative to be put on the ballot, the current initiative or the past
initiative.
So do you
So I had
support this
experience.
current initiative?
Do I support the current initiative? I support regulations that allow for the public's already valid responses to be implemented by the city. I know we didn't discuss, but Imperial Beach voted for Proposition 64 at an overwhelming majority. More than any council member.
More than any city, but I'm asking you, do you support the current ballot initiative?
I do. I support any initiative, whether the city puts together regulations or this current initiative. I support the current initiative if the city doesn't do anything.
If the city doesn't do anything.
That's correct.
Okay. Thank you.
And I will lend my support. And as I remind you, we got 15% without a problem. We just didn't go for the special election.
Thank you, Mr. Boyd. I appreciate it. Tracy Rivera.
Good evening, Mr. Mayor and council members and city staff. Thank you for allowing me to address you today. My State Farm Insurance on 1239 Palm Avenue on Imperial Beach, and I'm also the chairman of the Imperial Beach Business Improvement District. Was just elected in July, but there's some issues that we're dealing with to come back with that. During the time, we did a site inspection of a facility in San Ysidro. There was only a couple of us that were able to attend during that time. The facility is the Southwest Patient Group. It's also a science center. If you have not been there, I would recommend that, especially the ad hoc members, would attend to at least see what a facility in our area is like. And I know that I don't know anything about this current initiative, so I can't say that I lend my support or not, but I do definitely lend support of the council looking into ways of making or having access to facilities in Imperial Beach, whether that be whatever those 17 different regulations or the different licensings available. And I just want to thank you. I'd really like you to see, I think some of you may have heard, I spoke to you regarding my personal medical marijuana use a few years back. And I continue to use medical marijuana, and I continue to feel that it has greatly affected my life in a positive manner. I've seen it do it for multiple other people. And this is something that I really wish that the council would give, as Mark pointed out, great interest in seeing that something comes through, and whether that is the city puts through something or whatever you come up with. But I do hope that you will find a solution for here.
You support, you support the process for us, but
Yes, I support the city continuing to look into it. And again, finding the right solution for the city. I do realize that there's some concerns and different things, but getting more feedback, more reaching out to the community and answering some of those questions. There's a lot of myths about marijuana. There's a lot of, one of the reasons why we didn't get good attendance at the meeting, and they verbally said, is they're afraid to show their support. They're afraid they'll lose their licenses or different things or be targeted. And any community member should not feel that way, regardless of whether it's our sheriff's department, our staff, or anybody shouldn't feel that they can't publicly state whether they support something or not in fear of being what it's not. As Marcus pointed out, that community meeting that happened last year or whatever it was, he couldn't get a place. They ended up having it at my insurance agency in a community room I had. And I even had a client ask me he didn't want to have insurance with me because he felt I stood out. And I said, come in, I'd be happy to share my personal story. I did. He left insurance with me and said, no problem. I completely understand why you support this. I don't know what the ballot initiative is, so I apologize that I do not know what this new one is. So I can't, but I do support access. Thank you.
sorry, I didn't have the microphone on. And then Eileen, hello.
Hi, everyone. Thank you for allowing me the opportunity to speak. My name is Eileen Ano, and I live at 1018 Florida Street here in Imperial Beach. And if you had asked me a couple years ago that I would come here and support access to cannabis, I would have been full of shock. Used to be something that I thought was very scary and terrible. But what happened is, I have two children, and my younger son suffers from severe autism, which includes severe sensory processing issues. And his older brother was accepted to the Naval Academy and wanted the entire family to come to his induction. His younger brother had not been on a plane in more than 6 years because he couldn't handle the stimulation in an airplane, and we had some really bad incidents prior to that. And so some of my friends, in hearing about this, told me about their experience. I'm friends with a lot of people with the disability community, particularly the autism community, and there's a lot of overlap with the epilepsy community. So one of my friends said, you know, my son Gab, you know, we put him on the cannabis oil to help with the epilepsy, but it's also helped with all of these other things that you're talking about with Max. I think you should try it. Now, I never ever thought we would be able to get Max on that plane. So she suggested a doctor to go see. I did. And we tried it. And lo and behold, he made it to Annapolis, Maryland, and was able to see his brother inducted. So cannabis has really changed our life. It's really eliminated, not completely, but it has helped so much with the stress of raising a child with severe autism. Most of all, it's allowed Max to go out and experience a lot more of life. I mean, this is a child who couldn't be around crowds, who, you know, certain noises would set him off all the time. So it's really improved his life. And in going through that, I learned a lot about cannabis and all of the other ways it can help people, and particularly with chronic problems. And I was lucky enough that I was able to go to a private doctor to get the prescription and the education. I know this is not possible for a lot of people. And despite the fact that there are plenty of studies showing how much more effective and safe cannabis is to treat so many chronic conditions and pain, doctors still will not prescribe it. And I know that in my, you know, I belong to Kaiser, they will not prescribe it. It's not part of their formulary. And many other parents I've talked to, and I'm assuming actually an adult, a relative who went through terrible pain with a kidney stone operation, asked to have it prescribed, and the doctor said no. They preferred to give opioids. We all know how dangerous that crisis is right now. It's killed more people than the Vietnam War, and yet doctors keep prescribing really dangerous narcotics while cannabis is safer, less expensive. So I think that what I want to see is access available to everyone, not just people like me that could afford to go to a private doctor. I want access where anybody who's suffering severe pain could try to have cannabis instead of turning to a narcotic. So please, again, what I want is sensible, predictable regulation. That's what we all need, with access that it is inexpensive for people. So please, if you don't come up with your own better initiative, please support the one that they put out there.
So just to make sure, you support a process where you evaluate the potential for having some sort of dispensary or storefront in Imperial Beach. But what you're saying is you also support the ballot initiative, which includes manufacturing and all kinds of other types of activities. Is that correct? Just want to make sure we're clear on what you're, because it is a complicated process.
Well, access is what is most important to me. But if we're going to have manufacturing, why not let people have it happen here? I mean, why should all the money be funneled somewhere else? If people in our community need this, why not employ people in our community to help give it to them?
Great, thank you.
Thank you.
Okay, so go back to questions, Mr. Spriggs. We can go back to council comments and questions.
No,
I don't have any other public comment. Oh, no, we have, I'm sorry, we have one more person here from the Association of Cannabis Professionals, Becca Taylor, and you're representing the people doing the initiative. Is that correct? You want to come up and then maybe we can ask you, is that okay? Good, okay. So maybe you could just briefly describe why you guys decided to come to Imperial Beach, and then who's funding this operation as well, so we're all clear on where we're at.
Gladly, and thank you for, my name is Becca Taylor, by the way. I'm with the Association of Cannabis Professionals, and I appreciate you guys giving me a few minutes of your time to kind of talk about this. So, as I mentioned, that's the group that I'm with, and we actually came to Imperial Beach because we wanted to see regulations pass that would provide access to business, patients, residents, good paying jobs in IB, for IB. And we're actually excited to, see that you guys have formed an ad hoc committee and have been moving forward with that. We'd like to encourage you guys to continue to do the research for best practices and outreach needed. If you guys do come up with your own regulations and pass it, I'm here also to go on record to say that we would rescind the Citizens Initiative, and it's kind of a fail-safe in case you guys are unable to come to consensus and come up with regulations on, that satisfy everything you guys are looking for. Then we have this as a backup and can put it to the citizens to vote and gather community support that way. So with that being said, we're happy to offer our services or questions if you have in the future. And we're in the middle of gathering signatures as we speak.
Great. Questions, I'm sorry. Mr. Spriggs, do you have any questions for them since you posted?
But I also, would like a question.
Yes,
and
go ahead.
To elaborate on the point you just made, because I think it's very, very critical. And that's as the city is working on coming up with its own approach to this, both of the subcommittee and the whole city council, and if we proceed with the resolution on this item, authorizing the city manager with resources to do some of the best practices research that you just alluded to. Are you implied that you would be willing to, you guys would be willing to consider the city's position before actually proceeding to a ballot with the ballot measure, with or without enough signatures? Because that's, I think, the question. If you get enough signatures for a special ballot, special election, which will cost the city, as we said earlier, somewhere around $350,000. And we have a measure that will accomplish a good portion of the same thing. Why would you be willing to go with the city's measure and save that money?
If you're talking about the city's measures and you guys passed your own regulation before we gathered the signatures, or even if we had the signatures to do the special in advance, or are you talking about putting your own measure forward in June, for example? Are you talking about a countermeasure, or did you mean coming up with their own regulation?
I'm talking about coming up with an ordinance
Oh, yes, if you,
that includes regulations, which would be sometime toward the early part of the year when the state is expected to come out with regulations that would lay the foundation for cannabis use, et cetera, or whatever the city comes up with in Imperial Beach as an alternative to a special election on the terms that have been laid out, which is a very all-encompassing approach. Okay, so if we come up with an alternative that does provide some of a reasonable portion of those kinds of avenues, would your group be prepared to go with the city's approach as opposed to forcing a special election that would be very costly to the city?
yes, I believe that was laid out in the option. Consider adopting regulations prior to signatures being obtained. If the city council found it was ready to consider and did, consider regulations, as you're pointing out, to pass its own ordinance, yeah, that would be ideal. We want you guys to come up with your own ordinance that is best for Imperial Beach. So yes, we would consider that. So
I have other comments to make, but I'll wait.
Yeah, I think
in
it's
case
ideal just
other
to
members
ask
have
Becca if she had
questions.
questions. Good. Councilmember Bragg. These are just questions for Becca, then we can make general comments.
Ms. Taylor, thank you for being here. I do have a question. Why did you choose Imperial Beach, and what were the 6 other cities in the county that received the initiative as well?
So the 6 other cities that first of all, Imperial Beach, along with the other cities, Vista, Oceanside, and Sanitas. I believe you actually have it listed out here. I don't have everything memorized.
Yeah.
Okay, hold on. I know I was gonna say Santee. I don't want to just make it up. All right. Chula Vista and Sanitas, Oceanside, Vista, Carlsbad, Santee, and Imperial Beach. We've submitted initiatives in all of those areas to provide access, kind of the same reasons that I mentioned before, to allow access for patients and businesses and regulations, since Prop 64 is passed and Prop 96. So that is the main goal. And
okay, there's 18 cities in the county. And so you chose those, and I'm wondering why you chose those cities. What you had a map, and you said, okay, we're going to choose these cities. I'm just trying to figure out the thought process.
Well, one of the other things, of course, prioritizing, somebody touched on this before, is this is one of the cities that had the higher number of people who were voting for Prop 64 and support. So, I mean, we did take that into account when we were looking at the ranking of where we're going to prioritize it. So,
Okay, so
and
that
you-
was part of the criteria for
that
choosing
was
the
part of
cities?
it. And you probably already are aware that San Diego has passed its own conditional use permitting process. Lemon Grove and La Mesa did in 2016 on the ballot measure. So they're not on there. They already have their stuff. So
Were you, was it you who was at the farmer's market or certified farmer's market?
probably was, yep, the pop-up.
Okay, I did see that on Facebook, and I did appreciate the fact that you did post afterwards saying that you were not part
Yes.
of the farmer's market. So
Mhm,
I
like that.
appreciated the outreach, but I also appreciated the caveat that you were not a part of the certified farmer's market. So I do
Yes.
appreciate that.
Thank you. I talked to Kimberly afterwards or during it, just so we could make sure it's clear.
Okay, thank you.
Mr. West.
Good evening, Ms. Taylor. I have a few questions. One of the things that the mayor asked was for, could you explain a little bit about the group you represent and who is the kind of the funding behind the group and just a little bit of background so we understand who it is.
Okay, Association of Cannabis Professionals is a local San Diego County group of, so there's kind of two sides to it. One, it's a business to business, cultivation, dispensaries, research, all of that together, as well as an advocacy group to help with regulations in local, municipalities to help advance gaining access to cannabis in Southern California, in San Diego County.
Okay.
Is the quickest and shortest version of that I can answer.
Okay.
The funding, it comes from all of our different members, so.
I'm sorry, I don't mean to jump in.
No, I was going to go there. I was going to go there.
Okay, so they do pay a membership. So, and they can either pay an annual membership, or if one of the things that we work, all the members in our group are properly licensed. That's part of it, why we do it, to make sure that they're following the rules. And so, yeah, there's also, if they choose, monthly, we help them get that licensing. So
And it's local?
it's San Diego County, so. Oh, that is depending on where, in the areas that are allowing conditional use permits, we have cannabis lawyers that are able to help them, and land use people. I'm not one of them, so I can't answer more to that, but I can find out more information for you if you'd like. So I don't want to just say anything if I don't know it.
Ms. Taylor, that'd be a great thing to provide to her,
Yep.
just so we know.
I'll
And
make a note.
I have a couple of questions for the city, but nothing for.
Just gonna sit silent, but I couldn't do it. What cities are allowing it right now? You said La Mesa, who else?
San Diego proper, La Mesa and Lemon Grove currently.
And how are they doing?
It is pretty much just started, so I could give you research on like Northern California, where they're a little bit ahead of the curve, or
Well, I know
other
we could go
other
to other
states. But
right,
yeah, I was gonna
let's just
say
stay
locally,
local.
it's so new.
Right. So I think it's important that we find out as a staff, and I think that's probably part of this research, is looking at
absolutely
these other areas, because I know I don't have the initiative memorized, but let's say you're asking for this, and we come up with this. There has to be a middle ground, and I'd like to know what the other cities are doing. So that's, I think, finding out, making sure we have open eyes, and look at all the different options, and find out what local cities are doing and how they're doing, and their successes or their failures, because we certainly don't want to jump into this and fail.
I agree. So like, I'll give you an example. The state mandates that the dispensaries are 600 feet away, from each other, playgrounds, schools. We actually said 900 feet, which would reduce the number that are here, actually at Imperial Beach, but it would still prevent, a monopoly of having only one. So, which is also important.
So if we came up and said, we want 1,800 feet, I mean,
After 1,000 feet, it would disqualify all the zoning areas. That's why we went with 900, and you notice the other ones say 1,000. That's exactly why we did that.
Thank you.
So we went size with it.
All right, thank you.
Thanks for coming in. Yeah, I guess I just want to assure you, despite, and we can address Mr. Boyd, there's no reefer madness hysteria here at all. As actually, at least I was looking forward to getting the feedback from the ad hoc committee in this process. This has been very well controlled in the sense that there's been no one's told us this is a hatchet job, this is going to be killed. I was looking forward to actually having an open-ended process to carry out our own process. And I want to assure you that if I'll address the public, there's an issue with the way something in the city is being carried out, let us know so we can be more inclusive, et cetera. But I'd like to have further discussion. I'd like to hold you guys to the idea that this city is open-minded. We're looking at this process. I think we're looking forward to hearing from the ad hoc committee. We haven't done that yet. So, because this sort of got planted in the middle. So I hope there's some further discussion and dialogue about how we can figure out how to evaluate this process on our own without feeling like we could. It actually makes me sick to my stomach thinking that we might have to spend tens of thousands or hundreds of thousands of dollars from our city coffers that we don't have, or even $65,000, because every penny we spend on that is money I'm not spending on kids. 30% of our seniors, 30% of our kids live in poverty. Every amount of extra money we have in the city goes to benefit our residents. And I'm really proud of that. So we're also proud of the inclusive kind of approach we have on planning, et cetera, in the city. So, and getting feedback from our residents. So hopefully you can respect that and understand that we're committed to a process that's fair. And so hopefully we can have further discussion about that. But anyway, yeah.
Of course.
And I hope you'll stay for the rest of the council discussion on this agenda item as well. And thanks for your presentation and your reasonableness and open-mindedness on this. I hope that reflects the whole organization. One of the other differences pointed out in the staff report between the measure in Imperial Beach and the measure elsewhere is the cannabis consumption lounges, which are an Imperial Beach feature, but not a feature for the other cities. And why is that?
Yes. So the short answer is that the concept of it is fairly new. It hasn't really been done anywhere in the county. Yeah, it's still new. Exactly. So so if you read in the initiative, it says it's a retail space we can consume, single use from noon to midnight. I mean, kind of as a test, in our discussions, the intent was to have them on, along Palm Avenue facing the street. And as far as why we chose IB first, I could ask the person who wrote it if there's like an official answer, but I would just say it's a fairly new concept, and I don't know exactly. Yeah, I don't have an answer for why exactly we wanted to try it, just other than.
Thank you for your honest answer.
Yeah, I'm like, okay, I need to go ask honestly, but.
Great, we appreciate you coming here. Yeah. Thanks. Thank you very much. All right, so now we can go back to questions, comments. Do you want to start with Mr. Sprigg for staff? And you can sit down. Thank you.
Yeah, I
appreciate it. Thanks for coming out.
Thanks so much.
Mr. Spriggs, did you want to start?
Yes, I would. And I'd kind of like to just sort of try to express what I think is a framework for us to move forward that will put us in the best position to address the California legislation as well as this initiative. And this probably won't be new to everybody because I think we've had conversations before, but I wanted to try to just very simply suggest maybe 4 steps that we ought to be taking. We absolutely have to have our own position, and if possible, a strong consensus on this council reflecting our constituents on what we would be prepared to move forward with by way of an ordinance. We have to. Otherwise, we're leaving it to the referendum process to essentially plant this in Imperial Beach, however the referendum states it, with us then playing defense with either a countermeasure or accepting it, whatever it is. I think it's an abdication of our responsibility as elected officials to not have our own position as a council as best we can. It may not be perfect. We may be 3-2 or 4-1 or whatever, but I have a feeling that we will work together and we'll get to 5-0. Second, that requires that we have the research and the information on what like-sized cities, wherever they are that have experience with this, probably other states, are doing, and what has worked and what hasn't worked in those small communities like Imperial Beach. What's happened with public safety, what's happened with law enforcement, what's happened with regulation and the cost of it, what's happened with traffic, what's happened with, schools, etc. What has been the effect in small communities, and what have been the sort of best practices that we can pull from different places if necessary to form our own conclusions about what really will work for Imperial Beach. So that's what those first two steps are, the same thing, really. That's what we need to do to come up with our own sort of outline or format for how we want to move ahead. Then we're in a position to actually sit down with the sponsors, because we will have arrived at what we think is reasonable based on research and best practices, what we're ready to go forward with. And we can then sit down and have discussions and try to get everybody under the same tent, so that we don't have to have a special election. We don't have to have a ballot measure at all. We will do it as a city council. Finally, if that fails, fourth thing, we have an alternative ballot measure ready to go. We've done our homework. We've done our due diligence. We've met with the sponsors of the ballot measure. We haven't had a meeting of minds, but we are ready to go with an alternative measure, and we're ready to go out in our community and get support for it. So to me, those are the simple 4 steps we need, and we need to authorize these funds for the city manager. If I understand it correctly, the $65,000 is to enable the city staff, either themselves or through possibly some sort of expert, to pull together the information that we need in order to make an informed a policy position of our own on where we stand as a council. So that's why those are the steps I think we should follow, and I really think we ought to move forward in that direction. But I know everybody's got various views on it, and I respect that.
Thanks for that very well thought out, concise presentation. So appreciate that. Well argued. Mr. West.
A couple things. One, for the city attorney, you mentioned that if this ended up, and I agree completely with what the mayor was talking about, that the spending money on this keeps me awake at night, because I'd rather go into many other things. But you said that it would cost, if we had a special election, it'd be $250,000 to $350,000. If we were able to make it by the June primary time, it would be between $25,000 and $40,000. When would we have to file that to ensure that it wouldn't cost that much, that we get in by the June 18th? I mean, when does the county register of voters require that timeline to be put in?
I need to look at some of the dates really quick to see, because it all depends on the dates of when they submit the signatures, and then it goes to the county, and then we don't have control over how long the county takes. But there's like a time frame, and I want to say it's like December, January that they have to get it done by for it to be consolidated with June.
Okay. So yeah, I'd love to know when that is. And then when we talked the last time we were here, I thought that one of the things that we were going to look at is having some details already on some of the similar sized cities, what they've done for other places around the country. Do we have any data on that? Because I thought that's what we talked about last time too.
Yeah. There is no really set, well, I could not find any single set of best practices for communities within, whether it's, I mean, there are standard sorts of regulations that they say, here's a model ordinance, but it really comes down to every different community. So when you take a look at what best practices are, it really depends on so many different variables. There are no two communities that are the same. And so, for instance, when we were sitting down with the ad hoc, that was one of the things that we had done. We had pulled regulations from Colorado communities. I had reached out to contacts that I have in Colorado when the state was going through that to receive some anecdotal information. Some of the things that we had taken a look at as it relates to separations, the state has their standards, but then each community may develop their own. And that's as manifest in the various different initiatives that were submitted. So the other sort of unique attributes that Imperial Beach has that are different than other communities as well is that we have really two commercial zones along two streets. We've got SR 75, and then we have Seacoast, and that's really it. And when you start to take a look at, because we put together some preliminary maps as it related to the separation requirements that are mandated by the state, and that yielded, certain areas that wouldn't stand out, or that wouldn't be eligible. So when you take a look at what some of the other best practices are, they are manifest in a lot of the elements that are in the state regulations as it relates to separations from schools, from other places where people congregate. But those are really effectively the best practices that are out there. Then they just become calibrated for the community, and that's the effort that we were going through and trying to elicit that feedback to understand what the community of Imperial Beach wanted or didn't want, so we could understand that. And that's when we had the initiative sort of, and that's when we had kind of going to put the brakes on so we could put this information together and bring it to y'all.
Okay, so I think one of the reasons why I'm asking these questions for the city attorney as far as the timeline too, is that I think we're running into a deadline here that is really fast approaching on us. And I think that we need to really develop a timeline that actually talks about where we're going to meet each one of these steps, because it's quickly approaching on us one way or another, and we need to be ready for that. So yeah, just a path to whatever we decide here to get to the end with a timeline of that.
I do.
Yes.
Mr. Mayor, I did find so what happens is if it qualifies for a special election, and that qualification comes within 180 days prior to a general or a special election, the city may choose to combine it. So it looks like the time period we're dealing with is if it qualifies for an election between December 7th and then the statewide primary election held on June 5th. So as early as December 7th, if it qualifies there, then you could choose to
Put it
the
on.
7th and after, you could choose to put it to
Gotcha.
consolidate it.
Thank
I do know that you have to get that request to.
We can't give it to
We can't wait till June. Right? There is some time period there, but it looks like we're in the mid-December, probably to January range, like I mentioned.
Okay. Thank you.
I'm going to piggyback off Mr. Spriggs a bit. I really liked what he came up with. Coming up with our own position is a key, that we have ownership on that. Research, definitely key. But we go into that research with no blinders. We can't go in there going, okay, this is all I see. We need to go in there with open eyes and make sure that we're fair to all stakeholders. And you said sit down with the sponsors, and I was thinking really sit down with the community and let the sponsors come. And then everybody could hear it. And then the timeline was also something I had looked at too. And December 7th, you blink your eyes a couple times, we'll be there. And so it's going to be amazingly quick. So I definitely support exactly what I kind of reiterated from Mr. Sprigg. And I think we need to move forward on this ASAP.
Thank you. Councilmember Brock.
Thank you. I did want to state right off the bat that Mark West and I, Councilmember West and I, were the ad hoc committee.
You still are the ad hoc
We
committee.
still are the
Good,
ad
thank
hoc
you.
committee, and it has been a moving target, and we thought we had made some great progress, and then the initiatives and all kinds of things were hampering our progress. We all felt, and I think that includes our assistant city manager. I did want to say that this is really not a value statement. This is not a consumption issue. This is boiled down to a land use issue. And you're right, Councilmember Patton. We need to be fair to all of our stakeholders, and that is the hard part. And I did want to thank Marcus Boyd for your comments. That meeting that we had over here, I was there. I think Councilmember West was there, and there were a very few community members there. And we were wondering, gosh, where is, the pro and the con on this? And that has always been our issue. How do we, because I can tell you, I'm not going to vote on this until we have exhausted all of our efforts to involve all of our stakeholders. Ms. Rivera, I did want to thank you as the chairman of the Business Improvement District for hosting that meeting, having Mr. Dush be the guest speaker at that meeting. I saw your blast of getting it out to the business community, the BIDSSEs here in the community. And I think you had 4 people. I don't even think you had a quorum at that meeting. So you feel our angst is, gosh, how do we get people here to hear this issue that's going to affect all of us? But I did want to thank you both for your comments. This again boils down to us going, and we have, like I said, exhausted our efforts. Mr. Dush, I wanted to thank you for your efforts. You have quite a bit of experience in this coming from Fort Collins. And so have brought that to the table. This isn't just, the blind leading the blind. So I did want to thank you for that. I have a very hard time. It would be very hard for me to have to spend between $250,000 to $350,000. This community has some very great needs. So that causes me quite a bit of heartburn. So Mr. Spriggs, I thought you laid out a great action plan for us here. I would support our recommendations and also to envelop those that you had laid out as well. So thank you for that. This shows that you were part of an ad hoc committee before. And we have an esteemed colleague in the audience who was part of that ad hoc committee as well. So I just wanted the audience, and most of them are staff people. I just wanted to point out that we have been doing our due diligence on this. The state regulations, the state separations. How many, Steve, are there? 21 different regulations, and how many different separations?
Well, there are separations from what they would call, let's say, sensitive uses. But I think that there are 21 different types of licenses that the state would issue, ranging from, the various buckets of manufacturing, retail, testing, and cultivation.
Okay.
So there's variations of those, and it's 21 as my last research had indicated.
Okay. Ms. Taylor, I did want to thank you as well for being brutally honest with us and why you had chosen Imperial Beach. It was I think, in direct correlation to the percentage, the 64% of the PASHA, 63 or 64%. So there were people in this community who wanted it. We have to remember that there are people who did not want it as well. I do appreciate the number you had set forward in your separations. I can tell that you really looked at this community, you looked at our zoning maps, and if we follow certain regulations, there is nowhere to be found in Imperial Beach to have this. So it's just moving forward, continuing with the research that is desperately needed before we make a decision. So thank you for that. I appreciate it. Thank you.
Yeah, thanks everybody. And again, I think Mr. Spriggs will say a few words and we'll try to move forward with your proposal, which I think all of us were thinking about anyway. So just to be clear, there's no reefer madness at City Hall. It doesn't exist. There's no value judgments. I haven't had a single conversation where people said the evil marijuana doctor is around town and he's going to, make our community worse. For me, it's very clear. Our community made a very clear choice on the last election, and 67% of our voters voted in favor of legalizing marijuana, and that's what happened statewide. So, and it's very clear to me that our crime rate has gone down consistently while marijuana at some level has been legalized recreationally and then and medically. I smoked marijuana with my mom when she was dying of cancer. So, you know, I'm sure we all partook when we were younger. This is can be a very emotional issue, but I was looking forward to a process, and hearing the results of the ad hoc committee. I was a little bit surprised that we hadn't, when this sort of came up, like I was thinking, oh, aren't we going to do this now? Like, we should have had the report already. So I've been to Colorado. I visited places in Colorado, talked to folks in Colorado, including my wife's family who lives in Colorado, talked to a congressman from Colorado. So, you know, read all the literature on this issue, try to get some feedback, talk to council members from other cities. But I was looking forward to hearing back from our own ad hoc committee. But I want to share. But one thing I was surprised by is I expected when we initiated this process to have an onslaught of residents who were advocating for dispensaries and commercial facilities. And you know me, Marcus and Tracy, I'm out in the street. We're all in the street. I'm with the marijuana folks all the time. Anyone who hangs out in the pier knows exactly who we're talking to. And what I get from them generally is, I want POD to play. Literally, almost no one has come up to me and said, I want a commercial dispensary. It doesn't mean that it's not out there, but these aren't folks who are afraid of anyone, a value judgment of whether they're high at the moment I'm talking to them, or whether or not they're telling me they're going to get high, or how much weed they're growing in their backyard. But I expected to see huge amounts of people in the city from the comments that I got before the election, right, and the comments I got when I was campaigning. Because for a certain segment of the population, a certain age group, the number one question I got when I was campaigning, more likely, and first of all, probably a third of the residents I talked to, they're either high or about ready to get high, which was illuminating for me to see the extensive use of marijuana in the city, which is no secret to any of us who've grown up here and have been here. I expected those folks to advocate for dispensaries, and I just haven't seen that out there. So that was a surprise to me. Honestly, I was really surprised by that. So, but maybe you're right. They haven't wanted to come out. It's not easy to get anybody here, but the fact is, you two have been here at all these meetings and no one else is here. And so that concerns me, because I'm thinking, well, I'm not sure what we need to do differently to get that feedback. So we can work on that. So I think that was just for me, is I was looking forward to this process. I think for me, it's not a value judgment about marijuana. It's really about land use and making sure the city engages in the best practices as we move forward. But what I have been reading lately, again, I am following all the articles that come out in the media, not just the traditional media, but the other kind of media as well. The consensus is that things are a little bit in disarray in California. That's what I'm reading now, that is a little bit up and in. And then I'm concerned that we're going back to reefer madness in Washington. That concerns me. That's not a productive way to go. So I support what Mr. Spriggs proposed, which is moving forward with our own process, maybe getting that timeline moving, our own research, so we have an idea. And so the ad hoc committee and staff can come back and report to us sooner than later. So what you guys have asked for is evaluating an extension of the moratorium for another year. I don't support that for not another year. Maybe we do that for 6 months while we engage in this process, but we don't have to make that decision now. So.
Well, the only thing about the moratorium is it is going to expire on February 1, which means you have to have the second reading of an ordinance by January 1 to be able to have your moratorium extended past that February. And once your moratorium expires, you can't do it again on the same topic, unless there were new. The reason this was different than last time was that Prop 64 passed. So, and then the other problem we have is that we only have, well, we don't have a meeting on January 1st. We only have one meeting in December. So staff was looking for some direction. We have to do public noticing when you extend the moratorium. So we were looking for some direction, because if you want to extend the moratorium at all, it needs to be done essentially in November and the first meeting in December for it to take effect.
So there's two things that have been proposed in terms of what we're moving forward. It seems like the consensus is moving forward with this process. Our process is, number one, could we have a moratorium for 6 months? Is that something that you guys would like to see? And so as we can move forward with our process, or do you want to see a year? So I'm going to have something out there that says 6 months, but maybe that's something you guys don't want to support. And then number two, we'd have the council would support the authorization to move forward. Is that something we need to vote on, or we have consensus, or?
So tonight would just be giving us direction.
Okay.
No final action is taken tonight. As in terms of extending the moratorium, you could do the limited time of 6 months, but again, then you would be just 6 months. If you did a year, you could always lift it sooner, but you can't extend it more. When you're doing these land use moratoriums, There's a very defined process in terms of how many times you get to extend. So, but it's at the discretion of council. Staff suggested the year just because we're not sure how long this is going to take. We're not sure when the ballot measure would go on, if it's going to be a ballot measure, if it's regulations, et cetera. So
I would just like to
completely up to the
support
council.
staff in this regard. Because we can shorten it, we must shorten it. We have to get our own piece together and move it forward through the ordinance process. And we can't, because of the timeline of the referendum process, we don't really have the luxury of waiting a whole year. But who knows what the dynamics are going to be, going forward. We really don't know. So we should give ourselves the maximum amount of time available, but make it very clear maybe in the whereas clauses of this extension, that our intention is to, come up with an ordinance as soon as practical for this city.
And the other thing is the council, you're not making a final decision on that tonight. So staff could draft the ordinance for up to a year, and then the city council could make that ultimate decision when you're doing the first reading. So something to think about.
It's our responsibility as elected officials to make a decision. And I think we need to move forward, and this is just dragged on way too long. I think it's irresponsible for us to have this go on for 2 years. I think we made a decision. It seemed like we're moving forward. So so you guys can come back with that and we can make a decision at that time. But I want to make sure that we take the responsibility for ourselves to make these decisions. That's what we're elected to do, and get that feedback and move this process forward. So it sounds like we're all in agreement, at least on moving this process forward. So, yeah, Mr. Patton.
So, Mr. Spriggs, I think, were you saying that you like this as written?
I think it's fine as written, with the addition of our really robust discussion tonight, where it's pretty clear that you got 5 council members who want to get this thing rolling.
Yeah,
right.
I think that's the consensus. I think we're all in agreement. And then the way it's written, I'm agreeing that staff can come back with this, and then we can evaluate how long we want that for at that time. Yeah.
Yeah, it would have to be the second reading at that time. So you would have already had to take in the first vote, which sets in place the actual, the terms of the moratorium. December meeting would be the second vote, and you can't change anything at that time. As it relates to the moratorium, again, we're not talking about the ultimate regulations and everything at that point.
Now, I think I just wanted to be real clear about how I was thinking this could come together quicker rather than a long, drawn-out process. And I think that is by using these funds that I hope will authorize shortly to pull in whatever expertise that the staff and the subcommittee need in order to get some best practice information and put together a proposed sort of draft of what Imperial Beach, what a cannabis environment in Imperial Beach would look like, regulated by the city. What would be involved, if anything, in manufacturing? What would be involved, if anything, in growing? What would be involved, if anything, in retail? And any other elements, and give us something to chew on. The best job you can do with that external information. Don't worry so much about going out to the community and trying to, I don't want to say beat a dead horse. I don't want to say, get blood out of a turnip, but, we will come up with something, and then we can put that out to the community and see what people think. I think the idea of doing a community meeting where we have the referendum proponents there, to make their case as well, is a great idea. So, but we need to have something we can present to the community, whether, and it can be chewed on, it can be criticized, we can make an adjustment. We just have to have something that we feel is reasonable to go forward with. And that needs to be done very, very quickly. Enough time has gone by already. And so that's what I'm suggesting, that we reach out, get the external information that we need from best practices, put it together, and let's go out to the community once we have something that the council feels reasonably comfortable with. Right.
We have.
Can you top that, Mr. West? Because that was a great summation.
No, I'm good with that. I just want you to know
Okay.
there is data. We have some of this stuff already. Yeah.
Thank you all for your great feedback. Thanks to the community. I just want to make sure the community understands that we wipe the slate clean. This council, I know every one of us and our city staff are always interested in how we can engage the public more effectively and do things in new, innovative ways. And we get it. It's hard to get people to come to city council meetings or any type of meeting at all at any issue. So let's brainstorm on how we can be more engaged more and get more people engaged. Because I know we're all interested in hearing on this issue from the public. I could have asked you a lot more questions. And I think all of us are the same thing because we're just not hearing it from our constituents. So. Thank you. Great. With that, I think we're meeting adjourned.